Well, I will call this meeting to order. This is the regular board meeting, Monday, August 16th, 2021. Regular board meeting of the St. Peter's School Board, and we are located in the Middle School Media Center. And would we rise for the Pledge of Allegiance? The flag is that way. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Is there a motion to consider and adopt this agenda?
So moved.
Second.
Can I ask a question?
Please.
And sorry I got here late too, but would it be okay to move COVID protocols to an information item? I know that seems kind of crazy, but we have a lot of people to talk and a bunch of people who could come because they're at this. I was just saying, so what, yes or no on that?
We have a proposal.
I am proposing, I'll just speak up. I was proposing to move COVID protocols, keep it on the agenda, but to move it as an informational item based on that we have a lot of people to talk, and it would be nice to be able to absorb the information. And there's also a sports meeting going on tonight, and I know a lot of people felt kind of twisted about that, and it was kind of a last minute addition. And so I was wondering if we could move it to an informational item. And then we could do a special board meeting because we love them so much anyway. So then we could just do a special one for that. But we don't have to. It was just a thought I had literally while I was driving down here.
Any other thoughts on that?
Thank you.
I would counter that we do want to allow people to speak. We also want to let people know what the district policy is going to be in time for them to make choices for their families and their kids before school starts. So any further meeting 3 days from now, a week from now, would really cut into that time.
Fair enough. Just a suggestion.
It would mean that we're not voting on anything tonight.
If we moved it to an informational
Correct.
item. Correct. I even
so
thought
that
like the
everybody
end of
was
the
clear.
week. You know what
Yeah.
I mean? Would just, but maybe we need more time to plan. I don't know.
John, you made a motion.
Yep.
I
I'd
second.
like to, you wanted me to, asking me, I would prefer to vote on it tonight.
And your motion was to accept,
The agenda as is.
And I second it.
and you seconded that. I will call the vote. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Consideration to speak to the agenda. I know everyone's here for the building and grounds report. We have a stack here. If there are a few more to come in, I will just filibuster for a minute. We have a lot of people that want to speak. We have many people passionate about this issue on both sides. I ask that if you are speaking, please keep it respectful. I want to applaud St. Peter for almost entirely having really respectful discourse so far with each other, with the school board. However, calling a school board member a murderer for a position that they haven't taken yet is kind of outside the bounds of conversation, I think. So if you find yourself becoming disrespectful, I will probably cut off your time. We're going to limit speakers to 2 minutes. That may seem unfair. Tell me again in an hour and 20 minutes if it's unfair, because we do want to give everyone time to speak. So John will kind of stand up and, sorry, yes. Vice Principal. Or Principal.
I did. I was like, ooh, what's John gonna do?
Principal Graff will stand up, and when you have 30 seconds left, he will make some sort of like shaka bra or like salute or something to let you know that you have 30 seconds left, and then if you could kind of wrap up, that would help us all. The way I would like to interpret this agenda that we passed is that when we get into the action items here in a minute of COVID protocols, which is number 1, we hear the district recommendation because everyone wants to speak and we should know what the district recommendation is before we do that. After we hear the district recommendation, I would like to hear initial questions from the school board. As always, we kind of have 2 rounds of conversation, but we will go around the table and have initial questions. Those can be answered. Then we will have public input. And then after that, I think a motion to do something would be in order, and then further discussion, and then a vote on that motion. Does that sound good to the board? Excellent. And then I will say, after action item number 1, we will take a brief intermission to recharge our batteries, literally and figuratively. We have extra batteries here because these mics will die. So we want to do that, and then we will get to the rest of the agenda. Everyone is welcome to stay for the entire agenda. Some of us are legally required to, others are not. Feel free to leave at any time. If you want to leave right now, that's okay. If you want to leave after you speak, if you want to leave after the Buildings and Grounds report, it's okay. You're free to do that, except Mrs. Engeldinger. She has to stay. So that's how we'll do it. Moving on to approval of the consent agenda. This is a number of things, and we usually approve that as a whole, but we are free to pull items out and ask questions about any particular item. Does the board want to do that, or move ahead with a motion to accept the consent agenda?
I move to accept the consent agenda.
I'll second.
We have a motion and a second. Any further discussion?
2 items. Number 1, the bills are all in order. I stopped by today. And then also, item number 4, gifts and donations. I just want to thank the Blandon Foundation for their gifts to the backpack, their gift to the backpack program.
Excellent. Thank you for calling that out. Yes, thank you, Blandon Foundation. Further discussion? Hearing none, all those in favor of approving the consent agenda say aye.
Aye.
Opposed, same sign. Motion carries. We move to our action items tonight and COVID protocols. So Superintendent Gronseth, would you walk us through the presentation?
Sure. Before I start on the presentation, I just want to say that that near the end of July, we did provide our protocols and our recommendations for that time. A few days later, CDC came out with different guidance for us, and since then, things have continued to uptick with COVID, which has led us to making a recommendation that we did not think that we were going to be making. A few months ago, we didn't think that we would be even talking about COVID at this time, and yet here we are. So with that, I just wanted to start with talking about the priorities that we kept. Yes, principals, please come on. Just want to talk about the priorities we had as we developed our protocols last year for COVID and this year as we developed the guidance. And first and foremost is the health and safety of our students and our staff. When it comes to health and safety, we really want to err on the side of caution. We don't want to look back and wish that we had taken some steps. We want to hopefully look back and say, boy, maybe we didn't have to do that. But I'd much rather do that than the opposite. And then we really want to maintain uninterrupted in-person learning for all of our students. We know that the magic happens in the classroom. We want all of the kids in the classroom. And while we've applied for a provisional online that would allow us to do some online in short segments of time, we would like to avoid the necessity of using hybrid and distance learning this year. And then following the state and federal guidance has been one of the goals that the district, the school board has set for the district, And so we want to stay mindful of that guidance. So I spoke that things have been changing around the country with COVID. And during the last 2 weeks, there's been a significant increase in COVID cases in the United States. That's true with adults and with children. The peak is projected to last 4 to 6 weeks. That's according to the CDC. And as you look at the numbers on the screen, and I know it's probably far away for some of you, during the week of July 22nd, 38,000 new cases of COVID in children across the U.S. The week of July 29th, it jumped to 71,000. And the week of August 5th, it jumped to over 93,000. So you can see that across the country, cases in children are increasing, and they are becoming quite ill, and they are seeing more hospitalizations in pediatric units with COVID. The school districts that are listed on the bottom here, I know that they're all southern states, and I knew that that doesn't necessarily apply apples to apples. But because school starts in August in the southern United States, we're able to see what they've experienced. And their vaccination rates are a bit lower. They're about 20% lower than here. However, in Broward County schools in Florida, now this is a district of 75,000 students because in the South, school districts are arranged by county, not by community. They had 75,000 students. They had 470 cases among their students and staff, and over 1,000 in quarantine in the first week of school. Jefferson County, Kentucky had 66 cases, 291 in quarantine. Ware County in Georgia, 143 cases, 829 in quarantine. Marion County Schools, 43 cases, 839 in quarantine, and that's a district of 4,000 kids. Carson County, South Carolina, 151 cases, 570 in quarantine. Now, like I said, I know that this isn't a apples to apples comparison, but looking at what is happening in those schools, many of them are switching to distance learning, both because they don't have the staff to continue, but also the sheer number of students that are having to quarantine. So I also want to talk about recommendations versus requirements. Last year, as you know, the state of Minnesota was in a peacetime emergency. That gave the governor and the Department of Education and the Department of Health different powers than they have now. They do not have the authority to make a mandate if we are not in that peacetime emergency. So they have given us the strongest recommendation that they can without going to mandate, because they simply can't do that. So the recommendations are really to follow the CDC guidance. The requirement is from the federal government, and that requirement says all students must wear a mask while on a bus, both in private and public schools. So the CDC guidance tells us that there are a few different data points to monitor. The first is vaccination level, and then community transmission levels, which are from low, moderate, substantial, and high. The positivity rate, that's how many people are testing positive out of the people who are testing. The health system capacity of the community, and then your school community data. So looking at the vaccination levels, Nicollet County, which is the majority of our school district, we are at 59.7% of people 12 and over who are vaccinated, and 64.3% who have one dose. In LeSueur County, which is also part of our school district, it's 44.9 for fully vaccinated and 48.7 with one dose. Blue Earth is 56.8 fully vaccinated, 61.8 with one dose. Now that puts us ahead of many other counties in the state, and I'm really proud of the community for doing that. However, it still doesn't meet that 70% goal set by the state. For community transmission levels, last week, Nicollet County hit the substantial level with 30 new cases in the 7 days preceding that. That was up 87% from the prior week. LeSueur County is at high with 41 new cases in the last 7 days, and Blue Earth also in high with 86 new cases in the last 7 days. Positivity rate, the state would like us to be below 5% for 2 weeks before they would change our status. And right now, Nicollet County is at 5.21%, LeSueur at 8.76%, and Blue Earth at 7.37%. I know this isn't a perfect measurement, and I'm not a medical provider, so there may be some people in the room who could speak to this later. But I know that it's significant to note how many people are testing and what percentage of the people are testing, because you're likely, if you're not testing enough, you're missing cases, and that's as much as I can explain of that. Regarding the health system capacity, I have been in touch with Bree Allen, the county health specialist, and she tells me that our hospitals are filling up and that there are not local beds available, and that they are being sent to other communities because they cannot be served in our own hospitals. And as far as school community data, while we're out of session, we really don't have enough data to report on that at this time. So as the CDC talks about prevention strategies, they talk about it in layers. So each layer of mitigation builds on the next, because each layer is going to miss parts. So the more layers you have, the less risk there is. And so the guidance says the higher your vaccination rate, that lowers the amount of mitigation that you have to do. But the level of community transmission, that could increase it. So looking at all of those data points, if you have low scores in all of those, you need more layers of mitigation. If transmission is low and vaccination is high, and our other data sources are telling us it's okay, we can take off those layers of mitigation. So they say that the different mitigation strategies to use for schools are promoting vaccination, consistent and correct universal masking of all students, staff, teachers, and visitors inside schools, and that's for ages 2 and up. Screening or testing every 2 weeks for unvaccinated and 3 to 5 days after an exposure. Increased ventilation, hand washing and respiratory etiquette. Physical distancing of at least 3 feet. Staying home when sick. Cleaning and disinfection. Contact tracing, isolation, and quarantine. Now I just want to clarify that that's their guidance. Those are their layers of mitigation that they're suggesting. So our protocols in response to that is we have been promoting vaccination. We've been sharing information through multiple venues and will continue to do so. We've increased the ventilation in our buildings. Our systems are running longer, and it increases the airflow within our schools. Hand washing and respiratory etiquette, we have signage all over our buildings, and that's a skill that we teach directly to our students. We plan to do physical distancing of 3 feet whenever possible, noting that that is not always possible. Our guidance includes staying home when sick. We have cleaning and disinfecting. We are increasing our cleaning in commonly touched areas and common areas. Contact tracing and quarantine. Our families will be notified if there's been an exposure. Isolation is when positive cases stay out of school until 3 things are true. It has been 10 days since they first felt sick or tested positive. 2, they feel better. And 3, it has been 24 hours since they last had a fever without using medicine that lowers fever. And those are the same guidelines that were used last year. We have also added the tiered busing will continue so that we are keeping our elementary students and our middle and high school students from having cross exposures. And our original protocols, we are recommending universal masking for 2 years and up. So this is where the change comes in with the new data that we have. At this time, we're asking you to add a layer of mitigation because we are seeing higher transmission in the community. So we were asking that we require universal masking inside schools for the start of the school year. This would be in place starting August 30th through October 1st. And those who are not able to wear a mask for medical reasons would be exempt with documentation from a medical provider. We're proposing that this data would be reviewed again at the September 20th school board meeting to consider going back to recommended masking if the community transmission rate is moderate or low, positivity rate is below 5%, and that we've not had multiple cases within our school community in the days preceding it. So the reasons for this recommendation, why are we changing now? And it's really been a long conversation. And it started with changing guidance from the CDC and the Department of Health and the Department of Education. And then the American Association of Pediatricians also chimed in with their same support. Nicollet County is also supporting, following the CDC guidance, and our own local medical community has also been sharing their perspective. We've had increased community transmission to the substantial level. The surrounding communities all around us are at a high level, and we have an unknown number of cases within our school community. We don't know until once we get going how many positive cases we have. And most importantly for us, this keeps our kids in school. If our kids are masked, if our kids and our staff are masked, the CDC guidance says we do not have to quarantine if both the person who is positive with COVID and those exposed are wearing a mask. So this would avoid putting people in quarantine and would keep our students in uninterrupted in-person learning. And it also aligns with our priorities of putting staff and student safety first, of maintaining in-person learning, and it follows the state and federal guidelines. So I would love for the principals to chime in with their thoughts and what this means to their buildings and why we're making this recommendation. So why don't we start with ET? You can do that handheld.
Can you hear me?
It's not a speaker, it's for the...
All right. So in early childhood, certainly we understand that there are challenges with little ones wearing masks. We know that they're already wearing them on the bus, and I think we would like, I think we would like nothing more than to have our children back, not needing to mask and really sit closer to one another. Certainly, that would be our ideal, and that's where we want to get. Our priorities are the health and safety of our students and our staff, and having our
them did not earn accelerated credit. They were hoping to earn in an ALC environment. So it's important at ALC that we are in person and not quarantining, so that those students can accelerate financial aid graduation. At our site at Hoffman Learning Center, we need to follow the protocol of the residential facilities, and they are currently requiring universal masking for everyone indoors. So regardless of the school board decision tonight, those students will be masked.
I'm representing the middle school. For me, it really comes down to my job is to promote or provide the best possible learning experience for our kids. And for me, hands down, that's in person. And masks are going to keep our students in school. And I feel that that's what we need. I also want to talk a little bit about the logistics of quarantine if we're in a recommended state. If we're recommended, it comes down to knowing at all times who have their mask on and keeping track of that would really take the focus off of learning for the staff. So I really do support this. And on a personal note, I'm a parent of a middle school student. Last year I had a sixth grader who missed, in addition to all of the distance learning, missed a month of school due to quarantine. So I feel strongly that this is the right.
I'm representing the high school, and I can't speak to it any better than my colleagues up here have. Other than to add, we understand that at the high school, our students do have the option of being vaccinated, but I think the percentage of that from what we know are significantly lower than they are in the county. We also, I think tonight, I was at the kickoff for fall sports meeting tonight, and that was a really good. I wore a mask. The theater was packed. There were very few of us in masks, and I felt uncomfortable and awkward wearing masks. And high school kids who want to wear masks, I think that it just normalizes it for kids as well, and will help them feel more comfortable if their parents want them to wear a mask. Hopefully you could go to school and rip that thing off. The other thing, obviously, like John said, one of our priorities is obviously providing the best teaching and learning environment that we can. But only above that is the safety and security of our students and staff. And so I think as school leaders, we would be remiss if we were advocating for safety.
Hello, I'm Jerry Nelson. I'm the principal of South Elementary. And I was saying that it weighs heavily on my heart thinking about the fact that I have an entire building full of students under the age of 7 who don't have the option of getting the vaccine. I think it's a different scenario that is available to them as their choice. But for us, we take all kinds of safety precautions. We could put a bus tag on kids, put them out the door and say good luck getting home. But instead, we model it. We walk them through it. We bring the buses to school. We walk them out, meet their parents in many cases, and then there's follow-ups that are in place. We do those things because that's what we need to do. We need to layer it, we could say. And I know it's not fair comparison compared to getting home to staying safe, but this is one more thing that we can do. And I can tell you my experience of being with children last year and wearing masks. At the beginning of the COVID event, when we heard that we were going to have 5 and 6-year-olds, 7-year-olds wearing masks, we thought, how on earth are we going to get them to do that? And you know how we did it? We modeled it. We talked about the importance of keeping them safe, and we're the adults in their lives that are keeping them safe. So at school, they're our responsibility, and when we did it, they did it, and we really did not have any problems with students. So I guess my voice is for those that are unvaccinated and don't touch base, and that is where we are coming from the lens of being responsible for everyone who walks into our building and those that are home.
Good evening, everybody. I'm Darren Doherty. I serve as principal at the North Elementary School, which is 7, 8, 9, 10-year-olds. My colleagues here did a great job focusing on what our main job, what our main goal here is educating kids. I happen to be blessed to live with a medical professional in my household. We have a lot of conversations about education and the medicine field. I'm reminded many times medicine's not my wheelhouse. That's education, like very lovingly. And I completely admit that. Like my whole wheelhouse is education. So it's really depending on medical professionals and their guidance. Just like I would like that same respect if we were talking about education. First and foremost, in all my principal training was about the safety, health, and security of my students. Number one, and as you mentioned, all the students at North do not have the opportunity to be vaccinated. Like that's not even an option. So I feel like we owe it to them to make sure that we're keeping them healthy and safe. And as Mr. Graff said, like the best, we're humans. We learn through societal interactions. And so prioritizing health and then interactions with each other is the best kind of learning that can take place. It was very difficult and a lot of room for error to do that contact tracing last year. That again, that's not my wheelhouse, and we were all trying our best to do that. But if a precaution like face masks, which again, like nobody likes to wear. Nobody likes to wear that. We repeat that over and over again. Like nobody likes to wear these, but if it's something that could keep us healthier and physically in person, like that's something we could do.
Thank you. And so just in closing, please know that this recommendation did not come lightly. It came with a lot of research, a lot of conversations, and a lot of all of us spending a lot of time together, just really talking about what our best recommendation was for you. So that's what brought us here this evening.
Thank you. As I said earlier, want to have an initial round of questions. So, Member Hager?
Yes, I just was wondering, I need some clarification. When you were saying that if a student tests positive, then they need to stay out of school for 10 days or until they're feeling better. But then there's no isolation for other students in the class?
Right. If both the student who tested positive
Right.
and those who were around them
Okay.
were wearing masks, the CDC is not recommending quarantine.
Okay, so then how does that work then, like with a family member? If a family member tests positive and
So that is the one time that quarantine is recommended.
Okay.
Is if someone in the household currently has COVID and they are not vaccinated.
okay, that was my question.
Excellent. Dr. Soderlund?
I don't have a question because we've been working on this a lot. And thank you to everybody for all the work that they put into this. Tonight I have an open mind. I'm going to keep an open mind. And I think this is a well thought out plan. So I appreciate that, Superintendent. That's all I have.
Treasurer Carlson? Thank you.
I want to thank the administrative staff for their work on this proposal, and I also want to thank the community for reaching out. I've received so many emails about this, and I've read every single one of them and clicked on the links and followed them where they went. And I really appreciate all the information. The plan was just a Saturday that turned into a Saturday, Sunday that turned into until 5:30 today. I got to get back to my A job at some point. But I think this issue's important to the community, and I needed to take the time to learn as much as I could coming into tonight. And so I think I'll save the rest of the comments for after I hear from the community. I'm very excited to hear what the community has to say.
Thank you. Vice Chair Lokensgaard?
I'll echo what John just said. I did also read every email and follow the links, and I don't have a virus yet. We're good.
That's good.
We're trying to avoid that.
Yeah. On the computer virus. Computer virus. But yeah, I'll save most of my comments for after I hear the public speak.
Member Stewie?
Well, I have a lot to say, but just a couple questions. And maybe you guys can answer some, maybe you can't, but I keep hearing about that positivity rate, and that seems like the most bizarre statistic to look at. Because what we all need to do then is all go get tested so we're all negative so the percentage comes down. Do you know what I mean? Like, it just seems like that, maybe the medical people could help me wrap my small mind around that, because that seems like a really weird statistic. And the other, I just had a question about when we said the hospitals were at capacity, where did that information come from?
That came from my conversation with Bree Allen from the county.
Public health.
Public health.
Okay.
Yeah.
Well, my boots on the ground at the Mankato Hospital, and again, maybe I'm wrong, but said that the hospital indeed has been full for like the last year and a half, like they have kids always waiting from the ER. That for the last 4 to 5 months that there's been 0 COVID pediatric patients, a lot of RSV, and they're getting the RSV really bad. So again, we say this, oh, the hospitals are full, but they have been for a year and a half, and they're not full of COVID people. So let that be where it went. I have a lot of other things to say, but those are just the 2 statistic things that I was wondering about.
Thanks. Clerk Dixon?
I think the proposal was sound. We have a layered approach to keep the entire district, staff, students safe, in school, making education happen. I think that we are responding to new pressures, cases of the virus, and this is it's just an additional layer and a small tick. Small change, relatively small change. So I think it's a reasoned approach, and so thank you for putting it together. I appreciate the support of the admin team and their thoughts on issues. So, thank you.
Thank you. Just a couple of thoughts. No one here would ever choose to infect another person. No one wants their kids to infect another person. But we're faced with a decision tonight to best protect all of the kids and staff and families within the district. And I wanted to follow up on something that Member Hager said. One thing we can't debate and we can't choose is to not quarantine in a way that would be different from CDC guidelines. Like that's not up for debate. Is that correct?
Right.
So we can't choose, well, we're never going to quarantine. We're going to quarantine based on the CDC recommendations, which says if the kids are masked, then it's just the sick kid that has to quarantine, but nobody else. So that decision wouldn't impact any other kid in that class other than the kid who tested positive.
Correct.
Technically, if the CDC puts out a recommendation for quarantine, of course we're going to do that because we're responsible individuals, but the CDC cannot make requirements, so technically, I don't know. So, it's that whole thing of who has the power to do what. I'm not saying we don't quarantine, that's not what I'm saying, but I'm just, when you had said that, I was like, well, technically.
I'm just trying to focus the debate
I get
tonight
you.
on
You bet.
masks. Yeah. All right, we're ready for public comment. Are there any more cards? Yes, please bust your own chairs if you wish to sit. And Principal Graff will help us with the time. As we wait for maybe any additional cards, just to remind everyone, we'll go in order of received. So in a minute, I'm going to call up Rita Rosbach because she won the tickets for tonight. I feel like you camped out for REM or something. You'll have 2 minutes. I want to say that we are, like Treasurer Carlson said, and like we all feel, extremely grateful for your participation tonight. I want to apologize that speaking to the school board, I know you've all built it up in your heads as an awesome time, is a deeply dissatisfying experience because it's not a conversation. We can't really have a back and forth. We have a stack of cards, so it's literally, you get 2 minutes, we say thanks, and that's really all the feedback that you get directly about your comments. So just wanted to apologize, but it is a formal process. And with that, if it's okay, I will commence with the speakers. And Rita, if you could join us at the microphone, which only goes in, it doesn't go out. So.
Do I need to turn it on or am I okay?
It's on.
Okay, awesome.
We will never know, but we are told it's on. So.
Perfect. Thank you, St. Peter's School Board members and Superintendent Baranza, for all you are doing for our students and families. My name is Rita Rostock, and I will have a junior and an 8th grader in our schools this year. The past 2 years have been really difficult to navigate. It hasn't been easy to protect our families and our communities from a deadly new virus that is now mutated. The task has been made even more difficult by widespread misinformation that has minimized the local and global concern. One of the many things I love about our school district is a focus on teaching our children critical thinking skills, using facts to analyze and understand issues in order to produce possible solutions is such an important life skill. I see tonight as an exercise of critical thinking, as well as a demonstration of how education is always important, even for adults. All of us are here because we are concerned about our students and our families, and I think that's a testament to our community. Tonight, we have a chance to model to our children what we teach them in school. My background in research tells me that, as with all science, knowledge of this virus continues to evolve. As knowledge of the virus changes, so too will best practices for keeping us safe. The current science shows no detrimental physical effects from wearing a mask. In fact, there are many studies that demonstrate the effectiveness of masks. Researchers do not think that social or emotional development will be derailed by increased mask wearing. They're also adamant that the risks of not wearing a mask and potentially being infected with COVID and suffering from long-term health consequences, as a result, far outweighs risks related to the loss of face-related social inflammation. In fact, there are clear masks available, so if families would like their children to see each other smile, clear masks are a great option. Early articles claiming breathing problems associated with wearing masks have been retracted. In fact, here are some of the articles that have been used by popular media that have since been retracted, meaning they are erroneous. One is...
Thank you, Rita. I'm sorry, we're at 2 minutes. I'm sorry.
Oh my gosh, that was quick.
Thank you.
Thank you so much.
Thank you.
And I do have copies of the articles.
Okay.
if you want to read.
Thank you.
Thank you.
Treasurer Carlson will, for sure. Dr. Westphal.
Especially if there's links.
Thank you, school board members, and thank you, Superintendent Grunstead, for the great presentation. You took a lot of my thunder away, so no,
Sorry.
you did a great job. My name is Erin Westphal, and I'm a family physician. I care for patients of all ages. I take care of patients in the outpatient clinic, urgent care, inpatient general medical floor, and the ICU step-down, as well as newborn nursery. To speak to Tracy, I can tell you that in COVID, we actually didn't accept any pediatric patients from Mankato Hospital. Every pediatric patient has to be shipped to a different hospital because we don't have the level of care available for their kids. That's why that's a zero.
Well, there you go.
I can tell you that we had one day COVID-free in the hospital for adults, and that has since passed. I have 2 children in the district, ages 8 and 13, and I'm here with my healthcare colleagues to ask you to adopt the universal masking policy as recommended by the CDC and other agencies as mentioned by Superintendent Grunstead. I did just want to have a point of clarification on the vaccination rates, and I appreciate you bringing up the transmission rates in our community, so I don't have to do that. But vaccination rates, I just want to make sure everybody is aware, is 0% for kids under 12. Okay? They don't even have the opportunity to get vaccinated. When we look at kids 12 to 15, that's 42%. And when we look at kids 16 to 17, that's 54%. So when we look at the data, we need to be mindful of the fact that we need to look at the community of concern, not just the general population. I do want to mention that masks work. It works only when both people are wearing the mask. It works by reducing the source infection from the person that has COVID, and it works by preventing droplets to the uninfected child. You have to both be wearing masks, which again means that we need this to be required for everyone for this to work.
Thank you, Dr. Westman.
Thank you.
Dr. Sarah Robinson?
Thank you for the opportunity to speak. My name is Sarah Robinson. I'm a second-year family medicine resident based in Mankato. Residency is a time after graduation from medical school where we get time to have training wheels and expand our skill and knowledge set before a lifetime of public service. When I graduated medical school, I anticipated residency to be rewarding and challenging, but I did not anticipate to be in a pandemic. As part of my family medicine training, I rotate through different specialties, including the ICU, inpatient pediatrics, and palliative care. It's impossible to adequately describe the profound impact that COVID has had on the people that I see. Medical school prepared me for many things, but it did not prepare me to explain to devastated parents how COVID has led to their 2-week-old newborn being in the ICU. It did not prepare me to keep up the spirits of an immunocompromised individual who was on his 12th hospital admission for COVID-related complications. And it did not prepare me to sit with a previously healthy father as he transitioned to comfort care, as we had exhausted all of our options to help him, and his family was unable to come and stay with him in the hospital when he passed away. The people who I encountered are your neighbors, your friends, your family, and your fellow human beings. I went into medicine because I wanted to help people and to heal people. I went into family medicine because I realized there was significant power in prevention. We don't have a treatment that can cure significant COVID infections or severe COVID infections. The best and most effective tool we have is to prevent them from happening in the first place. And we know that masks work. On a personal note, I know that masks work because I've worked in COVID patient rooms, and the only reason that I'm healthy and I tested negative for COVID every single time I had to be tested is because I was either masked or double masked. I'm standing here not to ask you as a doctor, but to ask you as a human being who is heartbroken and tired of the death and destruction that COVID has brought onto our community to help protect those who are most vulnerable. COVID is real, it's here, and masks save lives. Thank you for your time.
Thank you. Thank you, Doctor. Dr. Roseanne Bishop?
So, I'm here in part because I was also at the Mankato Community School Board meeting earlier tonight, and the issue of mental health came up a lot. I am a licensed psychologist in the area, and so for the past 2 years, year and a half, have seen a lot of people subsequent to what's been going on with the pandemic. And so it is true there have been increased mental health issues. I think what is really hard to determine is what all is contributing to those mental health issues. So I know I've heard some people say, you know, it's masks that have led, well, it was literally linked to suicidality at the last meeting. I can tell you as a mental health professional, I have not come across that at all. What I've come across is people really struggling with the isolation that has come from our distance learning, the online learning. I've seen them struggle when people have been quarantined and they again have to be isolated. Certainly I hear plenty of people complain about the mask. My patients complain about the mask. I sometimes complain about the mask. But heck, I have not heard, so I'm only speaking anecdotally, I don't have my research with me. But I haven't heard anybody saying that the mask alone is enough to have caused the severe anxiety, depression, and the other mental health issues. Online quarantining, let our kids smile. Absolutely. And there are clear masks. I'm glad somebody already mentioned that. We use them in the clinic. We use them for people who are deaf or hard of hearing, so they can read lips. So that also can help kids read the teacher's lips. Sometimes that helps with learning. I'll leave that out. I know I'm almost out of time. So then let's look at, is it a choice? So we hear people saying, can't we just make this a choice? Trust kids, trust parents. I trust parents, I'm not going to trust kids. Smoking, you used to not think it was bad, it is now. Time out. Okay.
Thank you very much.
Stigma.
Thank you.
Somebody mentioned that.
Thank you. Dr. Stelter.
Good evening. I'm Dr. Keith Stelter. I'm a family medicine physician. I live in St. Peter. I have 2 children who went to this school and now are college graduates happily, so we are formally empty nesters. Thank you very much, St. Peter Schools. Teachers and administrators create the expectations and behaviors and academic outcomes. And we heard Superintendent Gronseth mention that and some of the principles, that we model our behavior. You are also critical thinkers, and the school creates critical thinkers. That's an essential role of what you do. And it's true that statistically, death is rare in children, but we don't want our children to be one of the statistics. And we don't want to set ourselves up to say that we did everything possible to prevent COVID in one of our students. Should one of our students die, and we say, you know what, we did away with that mask mandate back in September, and then a student dies in October 1st, we will not feel good about that. So I really urge that it may not happen, but we don't know what happens in the future. I also want to say that universal masking removes the segmentation from those that have and have not, and those that can and cannot get a vaccine. So it just makes it normal. COVID and the Delta variant has changed the game. This variant is 2.5 times more powerful. It has a better lock and key mechanism to get into our cells, and it only takes 1 case of COVID to create the next variant. That variant doesn't come from 100 cases, it comes from 1. So if we can prevent that 1 case, that's a role that we all can play. And in COVID, we all have a role to play in preventing the spread of this disease, each one of us. We're going to need about 80% vaccine rate to shut down this Delta variant, and we're not there yet, as you have heard. So in lieu of that, we have to do masking.
Sure,
Thank
Leonard,
you, Dr.
may
Stelter.
I
Yes.
ask Dr. Stelter a question? I mean, you're the faculty down at, I won't if I can.
Maybe after everybody's done. Does that work?
Okay, thank you.
Kate Martins.
Thank you to the school board, and thank you to the St. Peter community. This is an amazing thing. I am here, I'm a grandmother, I am a mother, but I'm here today as a retired educator. And I'll be hearing all of you some medical information, and that's great. For me, it is always all about the kids, and I see a lot of kids' faces in here. And I know that there are also facts that we need to hear, and you're hearing them from the medical community. A fact that I haven't really heard is that the FDA doesn't anticipate an approval until late fall or winter this year. The fact is, and you've heard it, but I want to reiterate this, there is no vaccine available for anyone 12 or under 12. That's huge, because that's a large part of our student population in this area. Quarantine is not a good thing. Everyone believes, I believe everyone in this room would say that the best place for a student is in a classroom with a teacher. I don't think there's very much disagreement with that at all. The way to do that is a common sense, all about the kids, best interest of the kids approach. In my opinion, the best way to do that would be to approve the mandate for masking for everyone in the schools until there is a vaccine available for under 12 years old, and there has been the time for that to go into effect. So everybody, it's all about the kids. Take care of your own kids. Mask them. Thank you.
Thank you. Michael Reeser.
Mr. Chairman, school board members, as a faculty of this school district, I know that this is probably placing a target on my back, but there's some things I need to say. and there are some things that people in this community need to have heard. In Nicollet County, 0.001%, according to the Minnesota Department of Health, 38 people out of 34,000 of the county population has died of COVID-19. I do not use this number to downplay or minimize the people that have died. I use this number to highlight the fact that we face a much higher probability of death in our daily lives. I take my own life into my hands every day when I get on the 169 to drive to work. That's a choice I make. Yet we continue to drive even though our society has failed to remove all impaired drivers or risk from me. Nothing is 100% safe or guaranteed. The overreach of power and complete and blind following of the CDC, the MDH, and Tim Walz has created a group of students that will deal with long-term effects not only caused by COVID, but the continual mandating of masking and social distancing. The above-mentioned groups and individuals have flip-flopped on the science, destroying their credibility, in my opinion. I can tell you after observations from a group of faculty and administrators, which I'm a part of, we sit in the commons at the high school every morning and greet students as they come in. Those students have gone from smiling, chatting, engaged students to walking zombies because they have been pushed from socialization and interacting with people caused by anxiety and fear. As a person that has worked in an industry that deals with masks and other PPE items, I can tell you that for a mask to truly work, from my research, it must be fit tested to each individually and designed for specific type, size, and lethality of a particle, vapor, fume, or volume.
Thank you, Michael. As with graduation, maybe hold your applause until the end. Eric Chadwick.
Good evening. My name is Eric Chadwick. I have a 7th grade daughter in the school system, and I want to thank you for the time this evening. There are well-meaning individuals on both sides of this debate, and I won't denigrate anybody who wants control over their child healthcare decisions. But I would ask that I have that right myself, my child. Anybody who says that the science dictates what should be done here, I think is overstating the case. There hasn't been a peer-reviewed study, which is the gold standard, and I think if you ask any of these medical professionals, they'll tell you that. There hasn't been one saying that masks are effective. It's all anecdotal, and when people get sick or they die, it's a tragedy. But that's not a basis on which to make policy. Policy is something that shouldn't be relied on solely for the experts in the field or the CDC or whomever. That's your job. And you need to take into consideration a broader base of issues. To me, primary consideration is what's the best thing for my kid? And that's what I think everybody here on both sides is thinking. But I'm not a doctor and I couldn't get a degree at medical school yesterday, but I'll tell you what, I did the next best thing. I read the Wall Street Journal last week. There was a doctor at Johns Hopkins, and he co-authored a piece, it was August 8th, and he said he directly challenged the notion that masks are effective and not detrimental to children. He identified 6 different things, and I won't go through them, but you can read the article, and they're real. They cause effects on children. That's what we're talking about. Infection and disease are a part of life. Everybody has to deal with it. My kid deserves better than to live in a never-ending fear of culture that is stoked by things like mask mandates that I don't believe are necessary. Thank you very much.
Thanks, Eric. Bill Weber. Bill Weber.
Good evening. Thanks for all of you guys doing the work you do on the school board and administration. I'm Bill Weber. My wife Debbie and I have 4 children in the school district. I'm here tonight in response to the proposed universal mask mandate in our school. We're here tonight to support the current policy that's in place right now of it being recommended but not required. We, along with many other parents in the district and in this room tonight, believe that putting masks on our children should be our choice. We believe if you want your children to wear a mask, you should be able to do that. Nothing against masks. But the bottom line is that we need to get our kids back to normal. They have been through way too much through all of this COVID debacle. We can't keep putting this on them. The flu, it's been proven to be more of a risk and harmful to school-age children than COVID-19. We haven't ever required students to wear masks when there's a flu outbreak. The emotional toll of all this on our students is heavy. They need to smile. They need to see each other smile. This right here, this is my son. Smile. This is what he had to draw in class last year. This is not normal. And again, I have nothing against masks, but he's a healthy, smiling, energetic, and happy kid under normal circumstances. School is no longer normal. There are kids. It should be our decision. If you want to wear a mask, wear your mask. Thank you.
Thank you. Scott Smith?
Board members, thank you for the opportunity. I'm Scott Smith. I've got 2 kids in the school system. Obviously, masks are contentious. To be clear, we're not against masks. We're against mandating masks. A lot of people fear serious illness or death from COVID. They don't fear serious illness or death from mental anguish. Whose interests are you serving with a mask mandate? Are you serving those who are suffering mental health? A lot of talk about studies and stats. I don't want to talk about studies and stats. I want to talk about choices for my kids and who gets to make them. Many of us here, including those on the other side of the issue, will leave here and we'll go eat in the restaurants. We'll socialize without masks, in our homes and in others' homes. Some of us were at Rib Fest. Some of us were at the county fair. Both sides of this issue. Close quarters, not a care in the world. And that should be your choice. I don't want to take away that ability from you. But I don't want you to take that ability away from me or my wife either. I ask that you respect our right to choose what's best for our children. Let them smile.
Andrea?
Good evening. I'm Andrea Patches. I've had 4 students go through the district, and I have one right now. I have emailed all of you, so I'm sure you've seen the link to things. I'm not going to go into all of the things that I've emailed about, and I'm speaking extemporaneously, for which you'll be glad I have only 2 minutes. I wanted to speak to you from the heart. I have 40 years of advocacy for children. I have 5 children, and at one point in my life I had 4 under 5. I worry about these masks. I've sat in your shoes. I know this is a big job. I've sat on a school board. It's a big decision. You're setting policy. I applaud administrators that have had very positive contacts with every one of them, and I don't doubt what they say in terms of what they're trying to do and what you're trying to do. But my concern here is, how will masking these kids on a daily basis for this period of time to October 2nd affect their achievement? There are studies out there. I'm not going to, I think we've gone around a couple times about peer-reviewed and not peer-reviewed, but I know kids they're going to touch them, they're going to touch their face, they're going to move the mask, they're going to have more contact. I don't want to minimize the dangers. I don't want to minimize that COVID is very scary, but I agree with these others who have said we're living in a world now where when we constantly mask every day, that kid is reminded that there's a scary disease out there that I have to face. How focused on schooling and learning are they going to be if they're worried about a mask all day long? So I appeal to you, please also think about student achievement. And I know we don't have the data because of COVID. We didn't have data in 2020, and you have data for 2021, but we as public do not. But look at that and see, how can you amongst yourselves decide, is this affecting our student achievement? So thank you for the time, and I appreciate your effort because I do know this is a difficult decision.
Thank you. The Millers.
Good evening, and thank you for allowing me to speak. My name is Brian Miller. I'm a 1988 graduate of St. Peter High School. I went to this school at a very different time than what kids go to school today. Imagine your sophomore year in a new school. No friends, new teachers, new building, new atmosphere. Now throw a mask on. You can't see the faces of your peers. You can't see emotion or reactions when you try to engage in a simple conversation. Hearing teachers becomes difficult. It's difficult enough being a new student, and now you add another obstacle. Friendships become difficult to form. You feel alone and isolated. Depression sets in, and it's a downward spiral from there. I moved my family back to St. Peter last year. Back to a town I loved growing up in a school district that I knew would give them a quality education. What I just read was what one of my kids went through last year. Our kids are being conditioned to be afraid of the environment around them. We've heard that masks work if both are wearing. But I know people that wear their mask all the time are still getting tested positive. We pulled one of our kids out of the public school system already and strongly considering pulling the last one out. I don't want to suffer for another year like last year. All I'm asking is that it be my choice that my child wears a mask and not being mandated on us.
Thank you. Beverly?
I'm sure you've seen all the and we've heard it tonight, statistics of depression, of wearing masks. The key word is prevention. We take many actions in our daily lives to prevent harm to ourselves and others. That's taking our shoes off, wearing appropriate seatbelt, brushing our teeth, wearing a mask is a small act of benefit, saving our children from what we can be experiencing. I agree with recommendation. Universal masking. It affects our economic recovery equation when parents are left scrambling for childcare because schools have resources online, with quarantine and lack of staff. Please remember the statistic of 94,000 cases reported in August 5th of child-related. Please keep the kids safe. Require a mask for students and staff, regardless of vaccine status, contact tracing, quarantine and further according to the guidelines. And the fact that we have statistics about
Thank you. Carolyn.
Thank you. I'm Carolyn Dobler, and I live in St. Peter. I'm the mother of a graduate from St. Peter High School, and also the grand aunt of a grandnephew and niece that go to North Elementary. I'd like to thank you for proposing your recommendations to require universal face coverings in the St. Peter schools. As a retired statistics professor, I've been closely reading the studies on the benefits and drawbacks of face coverings in reducing the transmission of COVID-19. The evidence overwhelmingly proves that face coverings substantially reduce transmission along with the other layered measures Superintendent Johnson spoke of earlier. One thing I would like to also mention is that COVID testing is not easily accessible in St. Peter, and I urge you to perhaps explore other options with partners so that this testing availability is available to all. In this rapidly changing situation, I applaud the superintendent and his team for quickly responding to the increasing community spread of the Delta variant in Pickett County by changing the district's COVID protocols before school starts so that our children have a safer learning environment every day. Thank you very much.
Thank you. Dr. Hong?
Hi, I want to thank everyone here for all your hard work on this. I know that I'm here as an educator, as a mother of 2 kids in middle school, and I heard a couple of things I want to respond to. There have been a lot of folks talking about personal decisions, making a personal choice for their family. And I think in some situations, if it's only going to affect you and your family, then that is absolutely valid. Where it changes is when your personal decisions impact other people's lives and families and the community members at large. That's where there needs to be larger guidance that needs to be taken into account. I want to reiterate the fact that a lot of these kids, all kids under 12, have not been able to be vaccinated. And the thing is that the longer there are unvaccinated people, the longer this variant and COVID in general gets to develop. That's fuel for the fire. As we heard one of our medical professionals say, all it takes is one case for another variant to emerge. The longer that we let this burn, the more it's going to burn down. And I think it's important to mention that the pandemic is the cause of all of this. The depression, the anxiety, mental health issues, masks themselves are not. It's the pandemic itself. That is the real cause of all of these challenges that we're facing and that our kids are facing. As someone who's lost, a brother to mental health issues, I take that very, very seriously, but I think it's also important to acknowledge what is the real cause of it and not mistake something that seems like it's an easier thing to blame. I have 30 seconds left, and I just want to make a point that I took a trip when everything seemed like it was going to be fine. I visited 2 people. I visited a friend of mine whose husband had passed away, and I visited my sister. While I was there, I learned that my friend, who had been vaccinated because her husband died of cancer and he was immunosuppressed, she got a breakthrough infection a few weeks before I came. And then my nephew, his classmate, 6-year-old, tested positive for COVID. So on both ends of that trip,
Thank you.
pretty scary stuff. Thank you.
Thank you. Stacy?
Hi, my name is Stacy Yokel. I've just been informed that we have a petition that's out, and we have over 200 signatures on it for people who are opposed to masking. I'm trying to speak louder, and I generally do anyway, so that everybody can hear. I don't know about the rest of you, but after being in here for an hour and a half tonight and having hearing loss, mild hearing loss in one ear, I have a headache and I'm exhausted from trying to hear the people with their masks on. A microphone would would have been extremely helpful tonight, because I have missed almost everything that the masters have said. With that being said, I would assume that anybody that is here with a mask on wants masks. And those of you without masks will be voting for no masks, for that to be optional, because this is a pretty full room, much bigger than you would see in a normal-sized classroom. So, with that, I kind of strained from what I was going to read. I do also want to say that having a friend who has a very high special needs child, I know that those children can get exemptions, but you need to keep in mind the kind of stigma that is then being put on these children. Children with special needs are already singled out. They're different. And then to take away their mask when everybody else has to wear a mask makes them stand out that much more. On top of that, for these children who have, like my friend's son, who has hearing loss, that is an additional issue for these children, that they can't hear when people have masks on. You go to a store right now and they got plexiglass on. You know what I do when I go up to that? I stick my head around so I can hear. I can't hear. And I can only imagine kids sitting in the back of the room with the mask on, plexiglass around them that never gets clean, by the way. So if somebody puts a booger on there on the first day back to school, it's going to be there on the last day. I know they're not.
Thank you, Stacy. Thank you. Sheila Anderson? Sheila Anderson, sorry. Please keep the clapping to a minimum. I saw her earlier. We have four others left after Sheila. Just update.
Hi, I'm Sheila Anderson. I'm a nurse practitioner. I've been in practice 24 years here in St. Peter. I have seen COVID. I've had a lot of people die of COVID. It's not pretty, it's not fun. Granted, they were all older people, but I've got a kid in school here. And if a mask prevents my kid from getting quarantined, when there's no online option because our teachers are burned out. I mean, we can't be doing hybrid, we can't be doing in-person where, you know, we never knew what day was happening. My kids have mental health issues. Marty wanted to be in school, I wanted to be in school. It's easy to wear a mask. If he's exposed to somebody with COVID and he had a mask on, I know that he's going to keep playing soccer with masks. Our sports are not in jeopardy. And he can stay in school and keep up with his grades, keep up with his mental health needs, and it just seems like it's easy.
Thank you. Tricia?
My name's Tricia Nauman. I've been living in St. Peter now for almost 10 years, me and my family. Moved here 9.5 years ago. My oldest started in kindergarten at Christmas break, so we moved here kind of in between. We love St. Peter. We moved away for a short while. We went to Madison Lake, and I open enrolled my kids to stay here because we like this school. With that being said, they are now entering 10th and 5th grade, so that time is back. I would like math to be optional. I've allowed my children to attend last year hybrid with math because they needed their friends, they needed class structure, and they needed the hands-on learning. Because also knowing that it was supposed to be free. Something that goes on almost 2 days a week, and now, a year and a half later, here we are wanting to extend it later. My child, her health then deteriorated because of doing the masks, headaches, not being able to breathe, things like that. That caused other issues. So then when it went full-time, we pulled her to full-time virtual. Well, then her grades suffered. So which path do I pick? What do I want to suffer? Do I want her health or do I want her grades? I would like neither. So ultimately, I would like it to be our choice on what happens to the masking, what happens to my child's body for that. And to be able to do that, can't be done here, then honestly, we would open it a lot.
Thank you. Dr. Keller. Kate Keller, Dr. Keller.
Hi, my name's Kate Keller. I'm a parent of a 7-year-old. His name's Oliver. We chose distance learning last year, and it worked pretty well for us. Honestly, I wasn't sure if the school could pull it off with the masking and the distancing. And I was really impressed by what I heard. From all accounts, the spread of COVID was limited in the schools last year. And the principals did it. And they made it work. And they saw the resiliency of our kids. They wore those masks and they did their work. They studied, they made friends. I saw them on the playground. I saw them smiling at North Elementary up the road from my house. I think they did a great job. And seeing our principals here speaking and saying they're ready to do it again, they need to do it again to protect our kids, makes me support these changes that are proposed by Superintendent Johnson. Another point that I want to make is that they have made, I think, a very judicious proposal. We are going to do this for the next 3-4 weeks and just make sure that we don't have a massive outbreak when we get back to school. And if things get better, then they are going to reassess. And I think that that is a very wise decision. I would also say, as we reassess, think again about the fact that our kids under 12 are not vaccinated. And if there's any possibility of having something different for the elementary schools, consider that. Many people have emphasized the way that our young kids are not vaccinated. We are maybe 4 months away from a vaccine for them. And I would just implore you to consider the possibility that once we get past that, we might be able to vaccinate much more widely in the district, protect our kids, and get rid of the masks, which is what we all ultimately want. Thank you for listening.
Thank you. Nicholas DeVetter? I believe Dr. DeVetter.
Almost.
Okay.
Hey everyone. My name is Nick DeVetter. I'm a 4th-year medical student, and I was the previous head soccer coach of the St. Peter boys soccer team. I just want to say it's really amazing to see everyone here. Everyone's clearly so passionate about the health of our community and of the children of our community. It's just really heartening to see. I want to just remind everyone that masks do not violate our personal freedoms. Public health is about everyone, and no one has the right to put another person in danger when we have the data reflecting the utility and efficacy of masking, in addition to layering interventions like hand washing, distancing, vaccines, etc. This is what public health has been since its inception. That's why we have mandatory vaccines for school like tetanus and polio. That's why we have speed limits, seatbelts, laws against drunk driving, etc. It's to keep people safe. This is not a political issue. We are in the middle of a public health crisis. This is not the usual flu virus that we've all dealt with in the past. COVID symptoms generally appear 2 to 14 days after exposure, whereas flu symptoms appear 1 to 4 days after exposure. COVID is more contagious and spreads more rapidly than the flu. Severe illness such as lung injury and long-term sequelae are much more common with COVID. School boards are obligated to protect children and staff so they can learn in a safe environment. In order to have open schools, we have to protect our children from COVID. The way we protect them is through layered interventions such as immunizations and universal masking. Thanks.
Thank you. And our last speaker, Carrie Sheely.
Everyone, my name is Carrie Sheely, and I have a incoming 5th grader this year to the middle school. Excited about that. Thank you for all the information tonight. It was very interesting, and I learned a lot from it. I didn't have very much of a chance to prepare, so I'll just read a little bit of what I wrote here. I would like to advocate for allowing parents to decide whether or not their children will wear masks or not. In my opinion, what is right for one family isn't necessarily right for all. I do believe it's important to protect the vulnerable. However, evidence suggests that severe illness in children from COVID is exceedingly rare. Recent developments suggest that COVID will be around for a while, and it makes me wonder how long then is the masking going to keep going? Children are also at risk from diseases such as flu, but there aren't masks required for that. I feel it is also important to consider living disruptions and other side effects from wearing masks. Every day we take risks for lots of things without ever batting an eye. It's time to start living life to its fullest. Please let parents make the best choices possible for their children based on the information that is currently available to them.
Thank you. I would like to applaud everyone. Thank you for, oh, yes, could you fill out a card retroactively? Excellent, thank you. Please, you can speak. And you will be the last speaker, so thank you.
My name is Melina Chadwick. I'm a 7th grader. I was stolen the entire last year because we were doing hybrids, and I hardly got to see my friends. I would like to be able to hug my friends without worrying about whether or not I am going to get sick. But because we have social distance mandates and everything, I can't. I'm not allowed to. We have a mandate. I get headaches when I wear masks for an extended period of time. Maybe over an hour and a half, I get a headache. And it distracts me from what I know I am capable of. I heard one of the people in support of masks saying that her son does soccer with a mask on. I also do soccer. And I did soccer with a mask on when COVID was last summer. I came home with a headache every day that I had soccer because I had been exercising with a mask on. And the fact that there are things we can do to stop that by not having masks is, why aren't we doing that then? Because the rate of people who get sick, people under 12 can't get COVID, or can't get vaccinated. And when I understand that that is a risk and that that is something that we need to take into consideration, but anyone over 12 has the choice of getting vaccinated. So if we are choosing not to get vaccinated, why should we have to keep wearing masks?
Thank you.
Thank you.
I would like to applaud everyone for having the courage and passion in our district to speak tonight and to sticking to the time limit, which I realize was a little draconian, but allowed us to get through that in an expeditious way while still letting people speak their mind. I appreciate that. Would like to have continued discussion, a motion if anyone is ready to do that, but I think now is when school board members can discuss everything that they heard from the presentation to the public comment. And I understand that Dr. Sullivan has stepped out for a second, and we will maybe give him a second and then resume that. Does that sound fair? I didn't see when he left. I guess we can start with conversation.
Oh, I was just going to start my juggling act. Darn it.
You promised us juggling, now you have to produce. Thank you. Dr. Soderlin, now is the time for more discussion after hearing the presentation and speakers. So why don't we start with around the table, actually, and we'll go the opposite way. So Court Dixon.
I guess we can continue to discuss it.
Or if you want to offer a motion, you can do that as well.
We might as well. So I move we approve the updated COVID data protocol. I move to approve the updated St. Peter protocols. We have a formal name for it? COVID protocols.
Is there a second? I will second it. We have a motion and a second. Now we can have more discussion.
Okay, so discussion-wise, I heard a lot of compelling information tonight and feedback from everyone. Thank you all for being here. The way that it is framed in my mind is that it really is a safety and security issue within the schools. That is our number one concern above all else. Safety of the children. And it doesn't even need to go much further than that, but there is other compelling information. We're also looking at, we're in the middle of a pandemic, and we're looking at slowing transmission or reducing transmissions in our communities. We have a large group of students who are under the age of 12 who are unvaccinated and don't have the option to get a vaccine. A vaccine would be great because that would be a very effective way of reducing transmission within our community and our schools. But that's not available to us. Wearing masks is also an effective way, probably the next most effective way of reducing transmission within our schools. So that makes sense to me. It's a relatively simple procedure and act to help reduce that transmission. We also, the timing of this I think is important as well because we don't know what the true presence within our school community. We don't know who has a positive, who's carrying COVID right now and who isn't. If we open the doors of school with no remediation measure, that's a risk that we can prevent by just wearing masks for a bit. We all know we want this done. No one is happy about this. I am not happy about this. But it seems that there's two major ways that people are going about it. Some people are just deciding that they're done. Well, I don't want to deal with it anymore, and I'm done. And it's just not effective because COVID continues to go. And so the most effective way to get this done and over with is to stop the spread, get our vaccines, put this thing to bed, get a hold of it. And to do that, we need time, I think. And this updated guidance and proposal will assist not just us, but the larger community some more time. That's how I see it initially.
Thank you. Member Stewie.
All right, well, I know that no matter what we do or say, that we're going to have approximately 50% of the people in town that are going to probably hate us. But
welcome to the board.
I appreciate that. But I guess I'm just going to say why I feel the way I do. And that's the great part about America and a great part about being on a board. As my friend Mr. Carlson said, we're 1/7, and this is my 1/7 opinion. I do worry about the mental health of our students. And here's my deal. So on Saturday night, I went to an establishment because I needed to give somebody a ride home, okay? As we're sitting there was a lot of fun going on, right? Everybody is laughing and having a good time, and I thought to myself, you know what, I bet if we all had masks on right now, this wouldn't be nearly as interactive as it is. That's the same for our students. They aren't nearly as interactive. So there's that, okay? I don't have great, like, going from one to the next little segues, but I just have thoughts. Here's the other thing. I was at the fair, found out there was 3,500 people in the grandstand. Yes, they were outside, but they were probably sitting about this close. That's the Nicollet County Fair, and I think the Nicollet County Public Health, if they felt that that was going to be a problem, which they would know that the grandstand sells out every year, that they would do something. And so there we were. So now we have our kids going to the fair, they're getting ice cream, they're going on rides, they're petting animals, they're running through the buildings and without their masks, and now we're going to put them to school and there's your mask. And I just think to me it's not fair to the kids. The other thing is I don't believe that if we say no mask that we automatically go to distance learning. I don't believe that. I believe that we see where it will go. I feel like we're acting on something before it really happens. And I just worry about what is the future then? So if this is what it is this year and next year's the influenza, are we going to be asked to mask up again? Because we lost 2 kids to influenza, not this flu season. We didn't lose any because there was hardly anybody that had the influenza this season. But the year before we lost 2 kids. Were we all wanting to mask then? And so those are kind of my things. I had a mom who died from COVID. If she would have died from COVID, honestly, she probably would have died of influenza. I have several siblings who have cancer. I have a kid with asthma. I'm not insensitive to it, but it's all about the level of risk and what we're willing to do. And at some point, I feel it just the regulating needs to stop, and it needs to be a parent choice. That's how I feel.
Regardless of how we all vote tonight, I will exercise my right as a parent, and I will require my children to mask. I will tell them to have empathy for others who may not be in their situation. I will tell them it's a way that they can actively contribute to a national crisis. I don't want them to be the cause of someone else's missed test, missed game because of quarantine, and I don't want to potentially hurt a classmate or a staff member because of my children's actions. If there's a kid out there who wants to hit my kid in the face, first, I get it, right? Like sometimes, if that kid punches my kid in the face, in the community, that's a legal issue. If that kid punches my kid in the face at school, that is both a legal and a school issue. And the district will come to the defense of my child every single time, right? That's not a child's right to hit another child in the face. It's not a parent's right to have their kid, no matter how annoying my kid is, to punch them in the face. If I hit somebody with my car, I'm legally and financially liable to fix that situation. And like I said, nobody wants to be the cause of a COVID transmission. We don't want to do that. But the virus doesn't acknowledge that desire. And we may not know that we have it, and we may give it to someone else. I don't think anyone here is suggesting that they be legally liable or financially liable to those costs. So when we exercise rights, we have to understand that they do impact other people. And quarantine is not a choice. We're not debating that tonight. And what I heard was if all the students are masked and a student tests positive, yes, they must quarantine. They must do that anyway. Whether they're wearing a mask, whether they're wearing a purple shirt, it doesn't matter. They have to quarantine. But all the rest of the students do not have their choices taken away from them, right? They can remain in the classroom, they can take that test, they can go to the game. And I think we as board members need to think of all of those kids and all of those families' choices, not just Carl. So, Vice Chair Lopez.
Well, as we can see, this is a divided issue. And I can honestly say I've sat here and probably gone back and forth 3 times. I live in a household where there's 5 of us in my direct household. 3 of us have chosen to have a vaccine, 2 have not. That's their choice. They're all adults. And the bottom line for me is I do not feel that I should be mandating anything. That's my choice. I heard what Dr. Hahn said, how we affect others around us, it's a big deal. And so I implore those that are holding up signs and think about how you're affecting others and be nice. We just need to be nice. And we have to be cognizant of what we're doing around us and who's in our circle and how our life might affect them, especially for the little ones. We're all here. There isn't any of us that want masks. We want kids in seats. I agree. You know what? I like that if everybody has masks on, we don't have to quarantine. I struggle with the fact that I have to mandate that, and that's where I get hung up. And so I just implore everybody to understand the gravity, and nobody wants to get anybody affected or sick or what is going to happen. But right now, we don't have any data that says we've got a whole rash of cases in the school. Now, this being said, I'm pretty much on the fence. And if we come back to school and in the first week we got 6 cases, guess what, people? We might be headed to hybrid or distance learning, because last year this debate was, we want kids in school. There was no debate on masks. Everybody had a mask. We want the kids in school. Well, everybody, we want the kids in school. That takes all of us to work together. Whether you decide that you're going to mask or not. I get it. But maybe you better test. Maybe you better make sure that if little Johnny is sick, he stays home. That's it.
Thank you, Vice Chair. Treasurer Carlson.
Yeah, I just want to, again, thank all the people that spoke and all the people that sent out emails. It shows the passion that this community has to judge what they think is best for their child and for the community. I think there were good points made on each side. The one thing that I keep getting hung up on is we don't know what we don't know. That goes both ways, right? We don't know what COVID's going to be like in 2 weeks. We don't know, what the future brings. And I just, that's the part that I think gets us all going in different directions, and science is there, and politics and fear and denial and different emotions all play into it because we don't know. We don't know. I desperately want our students and staff out of masks as soon as possible. But I think there's a compromise there somewhere. And compromise isn't very popular these days. People don't like to compromise. Usually people come away from compromise not very happy with the results. And I think that we should base what we decide on numbers. And I agree with you on that percentage thing. I would leave that part out.
Yeah, thank
you. But I think if we go 5 consecutive, because there is a spike, and the case rate is going up, but when it was in England and in India, it was a pretty sharp up and down. And so I think if we have 5 consecutive days in the moderate transmission area and a downward trend for 5 consecutive days, I also think there needs to be part of that is positive cases in the schools, whether it's in the building or in the district or both, like a combination. I can't think of a good plan for that. That requires a little Dr. Gronseth and some health experts of what that number might be. But I think that would be the third metric. I think if we decide to pass that, if we meet those two criteria, moderate transmission for 5 consecutive days and a downward trend for 5 consecutive days, I think that we should empower Mr. Gronseth to tell the kids to take the masks off, take them off, and allow them to be kids. We don't know what the first day of school is going to be like. We don't know what the first week is going to be like. And I am all for trying to get these masks off, but I don't want to do it recklessly. I want to do it based on data and things that actually take emotion out of it a little bit, so that we're concentrating on how to be the safest we can. The numbers that we would base it on is the best we've got now. Remember, the thing that we're using now as a data measure is different than what we used last year. Why? Because it's improved. They've focused on transmission instead of positive cases was the only metric that they had. And so I'm hoping that some sort of compromise, taking into the account the metrics and the criteria, that will, because if we go 5 consecutive days, moderate transmission and a downward trend for 5 consecutive days, I think, and that happens on August 31st is the 5th day, I think when we start school, we should be without masks. If that doesn't happen, I think that we should have masks. Wherever that happens, we'll revisit it as a board on the 20th anyways, but I think that the sooner we can get kids out of masks, the better. But I don't want to do it recklessly, and I want to base it on numbers.
Thank you, Treasurer Carlson. Member Dr. Soderlin.
I'm going to probably offend everybody, including myself. So.
I thought you were going to put on your A's cap there for a second.
So, my background, I'm a pharmacist. I went to Drake and got a pharmacy degree there. I got a doctor of pharmacy from Howard University. I've owned and operated community pharmacy in St. Peter for 23 years. Currently, for the last 25 years, I've been compounding drugs, and one of the areas that we work in is sterile, clean room kind of things. So I just want to start out by saying I don't think, I like science. I don't think we got a lot of science going on here. I think we got a lot of conjecture, a lot of emotion. I have had the opportunity to speak to several providers and ask their opinion. There are providers that are afraid to give their opinion, because we live in a culture right now where if you don't say what you're supposed to say, you get shut down. So I want to just do a quick illustration here. So this is a pair of gloves. This is a pair of gloves. This is a pair of gloves. They're all 3 gloves. Now, if I'm going to go out in the winter time, I'm probably going to take these and put these on. If you go to a doctor's office and they draw blood, they're going to put these on. What's the purpose of these? To protect the person drawing the blood. These are not sterile. They're just a barrier. These are surgical, powder-free surgical gloves. We use them all the time. These are sterile, and in order to use them properly, there's a whole procedure you got to go through, training, and then you have to validate. Everything is based on validation. And that's really an interesting word, because it, just like sterile is very precise, validation is precise too. So it essentially says, prove to me this is what this says it is. And then there's a a way to go through, put the gloves on, and then you do glove testing and verify that you can put gloves on without getting contamination. So that's really in a nutshell. Now, we have, this is a generic cloth mask. Everybody's aware of that. This is what I would call a surgical mask. And these are two different types of respirator masks. This is an N90 or a KN95, N95. N95s are under certain I don't want to get into the weeds, but they're both do essentially the same thing. Each one of these masks are designed for something specific. The cloth mask, in my opinion, because I've done particle count testing on them, they're theater. They do absolutely nothing. It's possible there is some benefit to it, but if somebody's wearing a cloth mask, I don't understand it, because it's orders of magnitude removed from doing anything other than it's theater, in my opinion. These masks are designed for something specific. They prevent you from spitting or spraying, but you don't breathe through the cloth. This fabric is designed to prevent water and moisture from going back and forth. They're designed very specifically for specific things. These KN95, N95 masks are designed for something specific, and they have to be wore properly, and then you'll get an effect. And the reason I say that, and I've taken these apart, done particle counts. My engineer did that for me at my business. The reason I bring this up is because I think we got a lot of emotion conjecture, and this isn't science. So you say, put on a mask. I don't know what you mean by that. Now, if you said an N95 mask that's properly fitted, okay, I get it. If you wore this mask and it was properly fitted, it would protect you and the other person. But you could go in and deal with certain pathogens, if you will, and be protected with that. So, that being said, I really have a hard time right now in the culture we're in, because we get shut down if anybody brings up an alternative viewpoint. Now, I've got an open mind. I came in here to, I'm leaning towards taking the recommendation by the superintendent, and I'll say why. But, going back to this concept that if everybody gets vaccinated and everything's wonderful, that's not true, because COVID has animal reservoirs. And I think anybody in the medical field will be able to tell me that we've never eradicated any virus that had animal reservoirs. So if we're going to go and start looking at things, it would be logical to look at house pets and animals around us, because they are a reservoir for this virus. So, I don't know. I feel for everybody here. I respect everybody. I appreciated and I listened to what everybody had to say. But at the end of the day, from my standpoint, it's extremely frustrating, because there isn't a lot of hard science here. We're in the middle of an experiment. That's what we're in. So somebody telling me the mask works, I have not found what I would consider a decent study, where we had a control group, and everybody wore the same mask, and then we compared. All right, I'm going to listen. But just saying masks, so some people had this on, some might have had this, I don't know what's happening. To me, that's not science. We got too many variables here. It may be true. It may be true that this is just as effective as an N95 mask. It may be true, but I think we need to just respect each other. I don't think I have the answer. I don't have the answer. I can talk somewhat intelligently about this kind of stuff, but I don't have the answers here, and I don't think anybody does. Whether you're in the medical field or you're in 7th grade talking. We're hearing a lot of opinions. So that's all I have. Thank you.
Thank you, Dr. Soto. Member Hager.
Okay. I really appreciate all the information. It was really helpful. I guess when I do, my first thought was, I just really feel like I had an idea in my head that I wanted to follow through with, and then I kind of got to talking to different people and kind of hearing different things, but it still brings me back to my same ideas. And being a social worker, I look at the mental health of the kids, I look at a lot of that different stuff, and I like the fact that, we're thinking about going into it for 2 weeks and then maybe having a revision of it at the September 20th board meeting and revamp it and see how we're doing. But then I look at it and I think, this is like everybody has said, we don't know when this is going to stop. It sounds like it's never going to stop. And how long are we going to put these kids through this? My thought is that I just really feel that if I were a parent, I would want to have the same what I did with my students. That's all.
Any other questions? Discussion?
I didn't know it was going to be once around, but we maybe have.
No, that's what I'm asking.
So, another thing, John, you've all said some things that I've been thinking about, and now they're all kind of jumbled up. At one time, John, you had said, we don't know where we're at, and I think you're absolutely right. You mentioned something like, we need having active cases in the school would be part of it, as part of a decision-making gate that we need to set up. Yes, maybe, but I think our intent should be to prevent transmission at all. Like, that's what we're trying to do. And Dr. Sullivan, you said something about experts. We might know certain things we don't know. I don't know. There's lots that I don't know.
Me too.
But I do believe that some people have a better grasp on the way to handle this better than others. And I'm thinking of, like, the people at the CDC. Do I believe that they are truthful and a group of scientists trying to better global health, and they vet their policies and recommendations? I do. I believe that. I believe that's the case with the Minnesota Department of Health. I believe that's the case with the Nicollet County Health Department. I believe that's the case with the American Academy of Pediatrics, with our local medical community. We've heard from almost all of these groups. We've definitely received their recommendations, and universally, they support the recommendation that's before us. So, for me, I don't feel like I am in a position to say, I think I got it better than these guys, because I don't think I do. So that's where I'm coming from.
Okay, so I have to ask, so if we're really, if we're gonna set the goalpost at prevention, well then let's all mask up, because that ain't gonna ever happen. It's like the influenza. It's always going to be there. And that's where I go to that, we have to, what's our risk level? What are we willing to, because there's a risk. There's a risk me driving here. There's a risk when a kid walks out, he could get hit by the school bus. Let's pull the school buses. We're not gonna do that. Things happen. And I'm not downplaying anybody who's suffered from this, but we're never going to have prevention. Like, that's just not reasonable, unless I'm wrong. If there's a prevention, then let's just hold out. Let's all do distance learning until that comes. It's total 100% prevention. I'm not going to engage. That's fine.
I'm never going to risk your kids.
Are we
Go
going
ahead.
around? I didn't know if we were discussing or what.
You go.
The one thing that I remember last fall, we had a special board meeting on a Tuesday or Wednesday, it might have been, to talk about the spike in cases. And we decided that we were staying in hybrid. Were we in at that point?
I think so.
Yeah, we were in hybrid. And then by Friday, it was 5,000 cases in Minnesota. All of a sudden, it was 5,000. We immediately, at least I called, and I'm sure other people did, and said, we need to get together again. We got this is bad. And in that situation, we used numbers to go, we're in a bad spot right now. And so I think that trying to figure out what the right numbers are, I mean, that's what we might revisit on the 20th. But right now, we've got guidance that there's low transmission, moderate transmission, high transmission, and was it extreme? Substantial, and then high, sorry. And I think that using those and using moderate transmission as a guide to, if we're in there for 5, right now we're in substantial, correct? And once we get down to moderate, I don't want to wait until the 20th to make that decision. I think that we did that, Dr. Soderlund did that the last time when we went back to in person, is the vote was, I say we let Mr. Gronseth decide when it's safe to come back. And we did actually come back a week earlier than was planned. And I just don't want to, on the flip side, I don't want to leave you hanging, okay? Because this is a very dividing issue. I want to give you some metrics to use so that you can go, yeah, the school board said, 5 days in moderate, and so you don't get yelled at, or we're still in substantial, I think that those numbers can kind of help make that decision.
Thank you.
Chair Leonard.
So, Drew, I agree that I totally lost what I was going to say.
She'll let you
It's
go
all right.
first.
You should have let me go first.
Sorry.
'Cause I-
Should have wrote
Just
down.
to follow up, or you got it?
No, go ahead.
We don't know what the numbers are going to do. What I heard from the presentation was we can insulate ourselves from the negative aspect of quarantine if we begin the year in masks, because if the numbers go bananas, we don't have to quarantine kids because the CDC says we're in masks. If the numbers go bananas and we're not in masks, we're also going to put our teachers in a position where they do have to teach both in the classroom and try and help potentially entire classrooms that are quarantined for 2 weeks because we had a case that we can't control. So I like the fact that masks at least give us an opportunity to not have that disruption to our kids and our staff and our schools.
I agree with that, but to a point. I think that at some point when we get down to moderate or even low, knock on wood, I hope, I think that we are in a position where the transmission, CDC says it's not a substantial amount. And so,
absolutely.
And so I'm not saying we start without masks. I'm saying whatever the numbers say is what we decide to do, and have our superintendent use the numbers as his guide to what's best for the community. And again, I just think that there needs to be some level of compromise to try to, and some guidance to use, and that's the guidance that we have. Again, I don't think the percent thing is a good one, but I think those other two are pretty good. And the school, I mean, if there's 8 positive tests and 9 in Nicollet County, and they're all in South Elementary, we need to mask up. So
you're thinking something other than the gates that are in the proposal now?
Yeah, I just think 5 consecutive days, because it seems like that will allow us to, it could happen August 31st, it could happen September 10th, or whenever, and it's not going to be, a mask mandate, because before then, because that if we give him the power to change that, it can happen as soon as it happens, instead of on September 20th. If we vote this, then the mask stays in place until the 20th, correct?
October 1st.
October 1st, it says on there. Yeah, it says October 1st.
I have a question for you, John.
Yeah.
So then you're thinking that, okay, so we'll just calculate by as the numbers go. So it's good now, we'll go without mask, and then it's higher high, and then we'll put mask back on. Is that what you're thinking?
Yeah, and since it's just doing this and not changing mode of instruction, I think that it's a simple thing, and I think to give a level of consistency, I think 5 consecutive days, it gives you an idea of how this is trending. Is it trending down? Is it staying in the moderate range?
The only thing with that I just get really frustrated with is I think that it's kind of like this meeting tonight. Nobody knew, it was kind of, okay, it's going to be in the governor's meeting room, it's going to be in the theater, it's going to be here. It gets so confusing that people don't know, are we wearing masks today or aren't we wearing masks? That's the only concern I have.
Right.
And it's not a masks on or masks off. Like, everyone's on and everyone's off.
Right, that's a good point too.
Masks are required, and then today, they're strongly recommended, but they're not required. And then, to your point, 10 days later, they're required now. So I get that, where it's like, tick, 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 tick. How do you be a bit of a nightmare?
If I could.
Yes, please.
So, just so I can, let me re-say it so I can make sure I'm understanding. You're saying 5 consecutive days in the moderate level and at least 5 days of a downward trend. So it's not zigzagging.
Right.
It's a downward trend for 5 days. And then we look at the community data as well. I think I would ask that it not be on a daily basis, but maybe at least on a weekly basis, that we would look at that data. Just because I think it would be tough if it was...
As a board, or?
No.
Okay.
Like, the admin team would look at it at least once a week. And because I think if we got to, like checking it every day, then it might feel like, okay, the random Tuesday we are recommended, but the next day it goes up. So now we're not 5 consecutive days anymore. So I think just putting a little bit of a measurement metric on there, that we check it weekly.
So here's my concern with that is if we need to trend downward for 5 days, there's only so far we can go down. So there's inevitably always going to be a blip up before. I mean, you're never going to see something like this. You know what I mean?
Yeah.
So it might always be like, oh, we're at day 4, but oh shoot, we went up 0.5%, and now we're back to day 1. And my other thing with the moderate, higher, I don't like that because I feel like the goalposts have changed a number of times, so I don't know if they're going to change what they consider moderate or substantial, or you know what I mean? Because it used to be like we didn't have enough masks, but then we got the masks, and then we needed the tests, and then we got the tests, and then we needed the vaccine, and do you know what I mean? So there always seems to be like the goalpost is always kind of moving. And in even looking at what those risks mean, that whatever that positivity rate, it looks like that's into that. So we are committing ourselves to that weird statistic if we stick with what they're saying. I think if we want to do something, it should be strictly based on what's happening in the school. Even if the whole community's going crazy and they all have COVID and we don't, then let's keep them here. Like, or you know what I mean? Like, I don't, if they're not, if it's not being spread here and nobody has it here, it doesn't matter what's going on at Family Fresh anymore. Because if our kids are okay, then our kids are okay. And then when we had the influenza, was it always like if there was like 5 or 10% of the population? Like, what's that for St. Peter? How many kids before we'd have to report to the state for influenza? Is it 5%? It is, because I looked it up. I'm pretty sure. I looked at right. So how many kids we have? So if you take that, I'm trying to put it into perspective of how we deal with COVID versus how we deal with influenza. Because we're really setting precedents, in my opinion. Because next year, if it's influenza and there's just a little bit of a breakout, we're going to be back in masks.
Well, I mean, to be fair, they are two separate viruses. One of which is causing a global pandemic. The other is a seasonal conditional virus that we've been seeing and dealing with for a lot of years. So it's not totally fair to speak to them like they're the same, because they aren't.
I just want to comment to your point. Number one, I would agree. I am open to, I mean, I'm just looking at what I see, to just come up with something, some kind of guidance. And the graph changed once. It changed from the in-person, hybrid distance learning. And so this is the graph we have now. And number two, I would be on board about the schools, but they don't live here. You know, if they're going home and they're with parents that, you know, have a job, and people there are infected with COVID or have the virus. I mean, that it could easily kind of blow us out too. So that's why I keep the community part in there. So
fair enough.
I remembered. And you guys are gonna laugh.
All right.
But you mentioned, Drew, we're not the experts. We aren't. We're not the experts. I can't imagine how many years of school is in half that room. Much smarter than I am. Just a farm kid, live west of town. And I'm not in education. That's not my forte. But for me, when we have to say people are going to do this, I mean, that's where I have an issue with that, is when we start saying you have to do this, or you have, and I don't, from my point of view, that's not what I feel like. I'm all for compromise, John. I'm willing to say, yep, but saying that I'm also not willing to, I care about kids, and I care about making sure that they're in the seats, and we start, because we're all going to be in school. They're going to be in school in 20 days?
Something like that.
14 days. So
they're going to need this room.
They're going to need this room. Better do some cleaning. Yeah. I just don't feel comfortable in saying we're going to make people do something that maybe they're not ready to do. That's my opinion.
If I could.
Please.
So, as I mentioned in the beginning when I started, this is not what we had hoped to be recommending, and in fact, it's not what we started out recommending. And staff can attest to how many times I've said, you know, boy, my medical training is really coming in handy now. I have done. What I have is 25 years of experience as a teacher and an administrator. And if we were talking about reading or math or science or social studies instruction, I would be able to talk about research and outcomes all day long. For the past year and a half, we as educators have been treading in a world that is not ours. It's public safety, it's medical. We do not have the expertise to make these kind of recommendations, as others have said. So we do lean on people like the CDC, like the Department of Health, the Department of Education, who is a bunch of educators like we are. They look to the Department of Health and CDC and say, you know what, if that's what you're recommending, we're going to go with it because we're educators, we're not medical professionals. That is why we are bringing the recommendations that we are. because as educators, we are leaning on experts in medicine. They in turn lean on us to help us to teach their children, because that's our area of expertise. I did want to mention a little bit about the vaccine and vaccines, and this, is it going to be with us forever? And I wonder if the school boards of the past, the teachers of the past, were asking those same questions when their students were getting polio, or measles, or mumps, or rubella, or smallpox. Because it is possible to eradicate something, almost totally. Happened to be in Rotary, so taking polio out is one of their worldwide goals, and they're nearing that goal. So it isn't that it has to be here forever. And all I can say is we are doing our best every day to keep your kids safe and to keep them learning. And our recommendations are just that. It's the best recommendation that we feel we have. So that's just where we are.
Say this virus is not like polio though, because it has animal reservoirs. So we can eradicate it in a human being, and it's in an animal, it's going to jump back in here. So my understanding is this is going to be with us from henceforth. Unless somebody in the medical profession could correct me. This has animal reservoirs, so it's here, it's going to mutate, it's going to be around.
Can I ask another question?
Please.
So, if this mask thing happens, will our volleyball team be able to play against New Ulm if they're not masking? And what if they have COVID? Then do they all have to quarantine?
This applies to the classroom.
But extracurricular activities is so
It's not included in this recommendation. We're not voting on that right now. This is classroom.
But all I'm saying is, no, I'm serious. All I'm saying is, if they go in masks, okay, and our volleyball team plays New Ulm, and they don't have masks, can that happen? I mean, it's not
Yes.
a recommendation, but it needs to be decided. Okay, so then someone from New Ulm has COVID. You know what? Does our team have to quarantine? Those are the things that need to be thought about. And then not so maybe as much in volleyball, but darn well in basketball and wrestling and some of those other sports.
That's a great point, because we don't have control over that. We have to quarantine. And what I'm hearing is the CDC says if everyone's wearing masks and there's a positive case, then the positive case has to quarantine and every other kid can stay in that classroom. So if a kid isn't wearing a mask, everyone else, even if everyone else is wearing a mask, they will have to quarantine, as I understand it.
So yes, they can play, and yes, they'll quarantine.
Well, they can play, but again, if we want kids in the classroom, if we want to guarantee that kids are in the classroom, as I understand it, we can do that with a mask mandate, because the CDC is telling us we don't have to quarantine except for the kid that tests positive. If we don't require masks and we allow people to make choices, and the kid who tests positive is not wearing a mask, then every single other person in that classroom or that came into direct contact with them will have to quarantine. And the result, whether we believe that it's necessary, whether it's a severe case or I just can't taste my soup today, we are going to have kids out of the classroom because that is outside of our control. So that, we have a choice, but that is a consequence of that choice, both for the district and for parents, as I understand. Is that incorrect?
No, that is my understanding.
Any further discussion? We talked about looking at different things.
Yeah, I mean, and that's interesting too, is I offered some sort of compromise so that we're not waiting until October 1st or whatever, and because I don't know if whatever proposal's up has my vote either way right now, the way it is. And so I just think that, and again, we used to compromise on things, and I get that someone's going to say you can't compromise on science, and someone's going to say you can't compromise away my right with my child, but there's got to be a give here, a little bit from both sides on this, in my opinion. And I'm, again, 1/7.
So Treasurer Carlson, what is your proposal? Spell that out for me again.
Well, and I take anybody's that has a better idea. I just think moderate transmission for 5 consecutive days. We talked about the problem of what if it clicks up for a day, because I also had downward trend for 5 consecutive days. And maybe we can just kind of read that, but I don't know. And then something for the classroom, for the schools, a certain number that I'm just not sure. I couldn't wrap my brain around it. You know, you almost need one individual schools and the district, you know. There's 0 cases.
Positive cases.
Yeah, positive cases at the high school, but there's 8 at South, heaven forbid. I mean, we need to, that's a time that South should be masking, you know.
So here's a thought, though, to throw it.
Yep.
Another curve in here. If this latest strain comes out and the data comes in and it looks like the common cold. I mean, some people end up maybe in the hospital. It's very communicable, but it's not deadly. How do we treat it? Or what if there's one that isn't, you know? So we're talking about the Delta variant, and now I guess there's some other ones that are lurking out there too. So
well, and
if there's a really deadly one out there, the Delta doesn't appear to be as deadly.
But at this point, if the Delta, American Airlines, whatever it is, we have to quarantine. So
if it's what?
If it's any
business
form of COVID, no, I was just making a poor choice about a joke about Delta versus another variant. But any variant, any case, severe or not, we have to quarantine. We don't have a choice in that. So I guess I'm not trying to think about are these severe cases or not severe cases, because we will have to quarantine regardless, and I think we all hope that none of them are severe cases. So,
can I respond?
Yeah.
I think you bring up a great point, and again, it goes back to we don't know what we don't know, and the more we learn, the more we'll know how to. And if we have to call a special board meeting on a Wednesday at the end of the month or whenever, I mean, that's our job. You know, that's our job to do that. If we learn new information that would allow us to give a better learning experience to our students, then I think it's our responsibility to get together and figure it out, you know, figure out what's best. Right now, I just don't, the only problem I have with this plan is it goes until October 1st. It doesn't have the flexibility to change if we're wrong. If all of a sudden, because of vaccinations or whatever reason, our district goes down. Our district goes down significantly, and we're not ready to react to that. We expect a spike. We don't know. You don't know what we don't know. Does that make kind of sense?
We also won't know if we're right. We might know if we're wrong. We won't know if we're right.
Well, I'm just talking about the numbers, right? Explain that to me, because
well, if we have a masking policy, I mean, if we have a masking policy and we don't have any cases, and we say, hey, we don't have any cases, this is great. Perhaps it's because of the masks that we're not transmitting it? I mean, we don't know,
Perhaps.
right?
Or it could be that we don't have masks on and we still don't have any cases, and then, you know what I mean? You can say that both ways.
Absolutely.
Okay. We don't know which way is right.
Yeah, we're only gonna know if we're wrong. I
Yep.
guess.
We're in a giant experiment right now. And there's a lot of experts out there, and I respect experts and that, but we are in a giant experiment. And there's gonna be some schools that will not mask, and there's gonna be schools that will, and then we're gonna hopefully go and gather information and see how that went. As distasteful as it is to me, I think I want a proposal on how we're gonna proceed forward. If there's some modifications to that, I'm open to that. I think we need to have something in place. I think we also need to look at fabric masks and decide, are we gonna accept what the science says, that they don't filter anything? Or are we just gonna say, well, I feel they might have some benefit. And I also say on the masks that the children need, if we do go with a mask, and we really care about the children, which I know we all do, they need to be changing those masks and throwing them away. This concept where we're walking around with basically a petri dish on their face and is ridiculous. So if we're going to go to a mask, I'd say we should change them at least twice a day. Change them out, give them a new one. And no fabric masks. That's what the science shows. Fabric masks they filter nothing, they don't prevent anything. So,
Would one way to ease some apprehension about the date, September 20th, October 1st, being too far away? If I'm wary of amending motions and seconds to the point of them being unrecognizable, but could we adapt that motion and the plan to say at the next board meeting, and that instead of saying September 20th, and actually look at moving that meeting until the 13th?
That is a board meeting.
I know, but it says reviewed again at the September
Oh,
20th
move the
board
board
meeting
meeting.
versus
Gotcha.
reviewed again at the next board meeting, which could be September 13th. It couldn't be the 6th, but I mean, that would give us, another few weeks. We could see what's happening in the state. It would give us a week, a little bit more than a week of school. Would that make a big difference in the plan for anyone? John, does that get at what you were talking about, or no?
No, it doesn't. That's a month. It's a full month. And so it's.
The 13th.
Yep.
What was the date you threw out?
The 13th, he threw out the 13th. I want to be able to change when we meet some of the metrics, meet some of the numbers that we need to meet in the moderate area for at least 5 days, I think and you don't need my vote to pass it. I'm just saying, if we're good on August 31st, I don't want people wearing masks for 2 weeks when they don't have to,
So,
or they still can. They're more than welcome to continue, but I think we
Right.
just need to have some more.
Okay.
So go
He's
ahead.
saying
No,
instead
I-
of dates.
I like
metrics.
okay, so can we explain those metrics clear enough to amend this motion in a second?
Well, Mr. Gronseth, you've heard what I said. I kind of want to defer to you because and we'll comment on it, but it's you're the one that's going to be making the decision, you know, and I want to know what you need to know to go, okay, if we're moderate for 5 days, you know, or is it 3 or whatever.
So I feel like the state had said that they wanted it. That was the percentage number. So the state kind of uses 5 cases as, you know, last year, if any certain school had 5 or more cases, they were put on the state list of schools with a lot of cases. So I'm feeling like 5 cases is probably a good case number to go with for local data. I think that the 5 days and a downward trend in the moderate zone, I think you could kind of combine those two to be that, you know, we're in a downward trend. It's not, you know, Tuesday is high and Monday is moderate. And,
right.
But that downward trend, I think, is I could work with that. And sorry.
Well, just a question of, because I heard 2 things, and I'm just trying to get us to a clear proposal, and then a vote on the motion as it stands or as amended. Clear metrics, but also superintendent judgment.
Mostly clear metrics. I mean, it's the numbers 5 that he said was what the state used last year, and I think Tracy does bring up a good point. You know, we're at you know, whatever that, I can't even remember what the range is, but I got it right here. So if we're at you know, 42, 39, 38, and then we go 43, but it was trending down previous to those 5 days. I don't want one day to, that was a great point, to throw everything off. I mean, it's going down, so that might be something that, you know, just we see and we know, you know, it's trending down. Yes, it blipped up one day, but in general it stayed down.
So one of those metrics would be less than 5 active cases in St. Peter's schools.
Is that per building? Per building?
Per building.
Per building.
Okay, per building. So we may make building by building decisions.
That would make sense.
Okay. Community transmission rate is moderate or low?
Yep. For 5 consecutive days. If it's sitting right on the edge, I totally
And what are
get
the
it.
numbers for moderate?
Moderate is 50 to 10. So that's a big range.
Per 10,000?
It's actually total cases in the past 7 days per 100,000. So that's why those numbers have changed.
So the moderate or low as defined by
5 per 10,000.
the CDC?
Is it the CDC's graph?
It is.
It is.
5 per 10,000 then?
Yeah,
You know,
actually
so-
what they said was, I think we get where it was on the graph.
And the positivity rate below 5%, we said.
Scrap it.
Scrap it. And a downward trend.
And scrapping the dates or leave the dates?
Scrap the dates.
Scrap the dates. You know what's hilarious? Is we're doing all this and then it probably won't pass.
Well,
I don't know.
It's something though. At least we got something. We're considering something to vote on.
So I will say that as we were developing this, and we were together for quite a while and knocked around a lot of ideas. And one of the things that we talked about was, do we go K-8 or do we go K-12? And our initial thought was K through 8, because then we cover all the kids who don't have a choice in being vaccinated. the reason we went with K-12 in our proposal was the fact that we wouldn't have to quarantine them, that we could keep kids coming to school in person. And I will say that we went back and forth quite a bit with the K-8 and the K-12, mostly because telling kids 47 times a day to pull their mask up is a struggle. But also because our high school students do have the option of being vaccinated. So that's another thing that could be in the mix as well, if that helps people to feel more comfortable.
And if they are vaccinated, they do not need to quarantine. Is that correct?
Yes, they do, according to the CDC.
But they
Not
can still
a-
transmit it.
I don't think that's what's in our plan, guys. What is my plan?
I think we're kind of at the limit of.
Does anyone, yeah.
So I go back to the whole thing if we don't vote tonight, but.
I think we have to vote tonight because regardless of how we vote, parents will be making decisions, and Mankato is mandatory masking K through 8, and so some of our parents very well may go there. And if we vote to mandatory mask, some of our other parents will very well choose to go other places, and they need this time to decide that. So
I agree. Great point.
So do we feel that the grade level is changing anyone's mind?
Just to restate that, it's universal K through 12.
The plan now is K-12.
Right. And was there a motion to or a suggestion to modify that, or?
I'm just asking if it moves the needle for anyone.
I don't think it does.
Well, and I think that, you know, if the numbers go up at the high school and not at the other schools, you know, I mean, that's something that we have to be concerned about.
Plan does consider that.
Right. That's why I'm saying that.
Good point.
I think for me, the overall thing is the simpler we can make it, the better off it is for everybody, for the parents, for the kids. I mean, so if we're saying, you know, high school kids don't have to, and I think if we're going to leave it, we need to just do it all the same.
Okay. So we have K-12. Community transmission rate is moderate or low as defined by the CDC for, was there a time period on that?
What did we say, 5 days?
Yeah.
5 days.
5 consecutive days.
Should John make an amendment?
Yeah, I'm just trying to
yep.
be clear as to what we're amending.
I'm writing it up there too.
Less than 5 active cases in St. Peter's schools per building.
Per building.
5 cases per building in St. Peter's schools at a school, high school level.
Yep.
So if you're amending the plan,
Motion.
I would like to offer a friendly amendment.
And is that on the 5 per building, is early childhood separate? Are we considering that a separate building?
It should, because there's no contact between.
yeah.
Yeah,
Okay,
they don't.
good.
They don't.
All right. Early
Well,
childhood
what
is
I'm-
separate.
Great question, though.
Thank
What
you.
I'm asking are we amending the motion or are we amending the district plan? Because the district is presenting their plan
I think we're amending the
But
plan.
a motion and a second were made, so it's out.
to adopt a plan.
Right.
But the plan is changing.
I think when the masking part, when we have masks on, isn't that kind of covered here? And then if it's not, this would be the plan if it was required masking.
Well, the current plan before us has the gates of community transmission rate is moderate low, positivity rate is below 5%, and not had multiple positive cases in our school communities. That's in this.
Right, but it doesn't kick in until October 1st right now, and I think if it's sooner, if it's much sooner, if we thought this was going to go a certain direction, it doesn't.
Yeah.
That's, I think.
Right. My only point was like that. The words are in this
Proposal.
Yeah.
Proposal.
So
you just like to take dates out.
Take the dates out, put the, I like dates when it was changing, you know, when we were considering different modes of learning, but I don't think it's needs to be in this.
So this would remove the dates. It puts a measurement on how long we're in the moderate. So you're saying at least 5 days, and that we have a downward trend case. And community data is, and you're putting a number on that as fewer than 5 cases in a building. So that would take the original, just takes the data out, puts a measurement on how long we're in moderate, takes out the positivity rate, and replaces it with the measurement in community.
Can we, I'm
And
going to
what
throw this
number-
out, can we throw the community metric out and just look at our school system? I mean, what would that look like?
The only thing I see with that is that they don't stay here, you know, they go home to the community. That's the only catch I have on that. Because if the community's high, they're more susceptible, maybe not in school, but when they go home. So that's why I thought.
What number is downward trending? What number are we looking at for the downward trend?
Number of cases.
Number of cases in Nicollet County. Oh, I'm having a deja vu.
You're saying because they're not going to go, they're not from St. Peter Community.
Right. I mean, yes, and people travel.
So is everybody clear what the plan is?
You want to read it one more time, just to make sure?
And I just want to clarify that this is, as written, it's for pre-K through 12th grade. Pre-K was not required to mask last year, and that was because the CDC was using 5 years old as the gateway, and now they've changed that to 2 years old. So this is saying that preschool would also be included in the mandate. Do you have anything you want to add to that, E.T.?
I don't like that idea.
So John, it was removed the dates. 5 consecutive days in moderate or low as defined by the CDC. Downward trend in cases. School community data rather than 5 cases per building.
And what I'm hearing from Dr. Soderlund is start at K,
I think so, yeah.
K-12.
So, but
I'm going to, what?
the CDC recommended pre-K.
I know, that sounds crazy.
So we can't really do some of their recommendations and not others.
We kind of are right
we're
now.
talking about doing none of them, so I think,
Well,
you know.
Yeah, if we're going to carve it up, let's carve it up.
Okay.
You want to speak to that, E.T.?
we can convey that information to parents. Thank you. So we have amendments to the plan, correct? Is everyone clear on what the amendments are?
Can someone read to me what that actually says? Can you read it again?
Yep. Motion to amendment proposal. Remove the dates, 5 consecutive days in moderate or low as defined by the CDC, downward trend in cases, school community data, fewer than 5 cases in a building, K-12.
Downward trend to cases. I think we need to clarify what that actually is.
I actually didn't think that that was a good idea because of what you
Yeah.
said. So
I was
if
gonna
I
say,
would
'cause
say,
we'll never get out of that.
yeah, I mean, if it bounces up one day, I mean, then I think that's, you know, when you see a graph when it's
Yeah.
trending downward.
Yeah.
So.
And that's what I meant.
Yeah, I knew what you meant. I think she was talking about putting a number on it. Is that what you were thinking, or?
No, I don't even really know what I was thinking right now.
Okay, I think downward trend is fine.
I can't even type anymore.
We still have 5 agenda items left.
At least.
Yeah, and we're gonna get there.
All right.
So, can we just, for the record, so we would like to see the proposal amended to remove the dates, consider 5 consecutive days in moderate or low as defined by the CDC, and that's moderate or low community transmission. A downward trend in the caseload, or the county, right?
Nicollet County or LeSueur County?
I think we can see the district data for that, correct? So no. Well, I would say Nicollet County because the majority of the district is within Nicollet County. If we're keeping that in there.
So it's the total number of active cases. It's
So
just going to be hard
whatever
to
it
keep on a
says.
downward trend. You know what I mean? Because if we're down to like we have.
You can-
Transmission measures new cases.
You can take the downward trend out of there because I mean, really, when you think about it, I mean, if we're 5 days in the moderate and it blips up one day, I mean, we're still in the moderate. As long as we're still in the moderate, that takes care of it. And it's going to have to trend down from where it is right now. So.
All right. We're removing the dates from the proposal, and instead of having a date where we would consider this to end, we are basing the end of the mandated masking to be based on 5 consecutive days in moderate or low community transmission as defined by the CDC, and looking at Nicollet County. The school community data, which is fewer than 5 cases in a building. So that says that we are making building by building choices on this. So we may be in a situation where one building is masked and another is not. And this covers K-12. Doesn't start at 2 years old. It starts at K and goes till 12th grade. That is what we have.
As proposed, I'd like to offer that as a friendly amendment. Needs a second, unfortunately.
Well, I seconded the motion, so I'm fine with also amending my second.
Oh, you're fine with it?
I would also like the record, such as it is, to reflect that this is the amended district proposal presented at 9:30. We do have a question that we don't normally take questions from the audience, but I can perhaps divine, and this person can maybe put down their hand if I'm divining this correctly, that they are wondering whether this includes a staff mandate or not.
Nope.
Nope? Okay. What's your question?
I would like to rise to the point of order. The chairman cannot second a motion or discuss a motion. An amendment has not been made properly to the initial motion. So the last 2 hours have been not germane to the main motion that this board brought forward.
Okay.
I can,
So the original motion was made in error, and that's my fault. We can still have initial discussion, so we have an opportunity to bring a motion, as I understand it. Is that correct?
Yeah, so there is no motion on the table. Am I correct? As far as- So then,
it's just,
So I withdraw my second because it's improper,
do we?
right? Is that what you're?
This is Robert's rules. No.
If it's
No, it doesn't embarrass us. We want.
We do a good
Yeah.
enough job on our own.
Right, absolutely. That's why I appreciate the help.
I think we
It's
have an
great.
option that I could rescind my initial motion, and we could make a second proper motion.
Yeah, you can rescind
With
your
the
motion
amended plan?
as long as you haven't had a second.
Yes, you have to write it down.
yeah.
So,
You have to write down that he rescinds his motion. I rescind my second because I can't make a second.
So we should be square flat.
yep.
And it's 7:05, so we're good. No, I'm just kidding.
So I would like to take the district's recommendation with the following changes to make a motion. Remove the dates of August 30th through October 1st. 5 consecutive days in the moderate or low community transmission as defined by the CDC for Nicollet County. School community data used, meaning fewer than 5 cases in a building. This would encompass K-12, and the motion has just happened.
I second that motion.
We have a motion and a second. Further discussion?
Everything else in the plan was as is. The only thing that's changed is the face masking. Right?
Right,
Okay.
I think. I mean, good point.
What? Yeah.
Well, they brought us the COVID protocol, and then they're amending the face mask portion, but the rest of it is all still applicable.
Right. Good point. We have a motion and a second. All those in favor of the motion say aye.
Aye.
Opposed, same sign.
Aye.
I saw that as
I
4
think you need
aye.
to say
You need to
abstain.
go around the table.
Abstain.
We'll do a
Need a
roll
roll
call.
Okay.
Member Hager? Dr.
Yay.
Sullivan?
Yay.
Nay.
Yay.
Nay.
Yay.
4-3 passes.
Passes 4-3. All right, thank you. Thank you, everyone. You're welcome to stay.
Call it up.
We're going to call the meeting back to order.
Thank you.
Chair Leonard has stepped out for a little bit. He'll be back, hopefully. But we'll go to the agenda item number 2, setting breakfast and lunch prices for 21-22. Superintendent?
Thank you so much. This is something that we talk about regularly, and although meals are free this year, Tim is going to tell us all about what the federal government is telling us to do.
I'll be brief here. As we do every year, we set the free meal
prices, free and reduced, or just the actual lunch prices. The reason for that is because it's a federal program, and they do not want us to not charge the non-free and reduced people a subsidized rate. So it's pretty highly monitored, the lunch program, because it's federal funds. We throw the numbers in a formula, and it comes out and tells us basically with the lunch price what we need to charge, or the minimum we need to charge. And it went up a dime this year. Part of the reason it went up is because last year we did not raise it because we got a one-year waiver because of COVID. Actually, the lunch prices for the students for the first lunch is not really material this year, as Superintendent Gruntz has said. The lunches are free and the breakfasts are free for this coming year due to the COVID. So we need to still approve this because they well audit it and look that we did it. But I guess you can see the recommendations on the prices there and the changes. And we raised the adult prices by about 3% just to keep up with the costs from out. Any questions? I know I went through it at the Finance Committee too, so I'll try to be brief.
I move to approve the breakfast and lunch prices, updated breakfast and lunch prices for 2021, 2022.
Second.
We have a motion and a second for approving the updated prices for school lunches. Is there any discussion? Any discussion? Seeing none? Call a vote. All those in favor of the motion?
Aye.
Opposed? Motion carries. Up next, we're going to consider the adoption of handbooks for 21-22. Bill?
Thank you very much. This is another annual event that we review changes in the handbook, and our principals are falling in line to share their changes. And yeah, weighted hours, exactly. And we'll start with South.
I will start because mine are very simple. So the only things that were changes to my handbook were the things, the COVID protocols that were in place last year. So as needed, we may have to adjust that as the year goes on, but many of those have been pulled back. So in those areas are listed.
It's pretty much the same thing as far as North goes too. There were some updates about start time because it was changed because of our format for what last year, as well as two appendices, just a fair pupil dismissal act of statute because it wasn't in the handbook. Access to all parents, so we thought I would put it in that handbook. Other schools have it, as well as current more information on what the policy that the board currently has, and one more item. Bus passes, just information about that. We didn't have any look.
And at middle school, we had 3 changes. The first change is just in the academic section. The change is really just to reflect the change in course offerings. Course offering elimination from March. Instructional programs about that. The second change is the attendance section. It really just reflects our start and end times. 8:30 a.m. start, 10:35. The last section, I don't know why this hasn't waited this long to change. There was a section in our handbook, basically defines the section. And the section said that students who have the end of the year obligation on the final grade for note or all obligations are met. That has not been a practice in our school. It's not a legal practice. I think what happened is when that handbook was adopted its first year, 4 years ago, I think that was we took it directly from existing handbook, and that section was kept. And it was done to change.
So good workout, Mr. Cora.
Just pass the mic. Take the mic.
Similar to the middle school handbook, that it, actually I have a confession to make that language that's being removed. Every year I'll go back and look at last year's recommendation and then make a copy of it, change the language and make it, that one was supposed to be removed last year. It was approved by the board to remove that from the handbook last year. And then the final product, it was still there. So it's in there again. Hopefully you still agree with that removal. We added a brief statement about our ALICE protocol for our intruder. And then we, in recent years, have been working through, we thought that we were very careful about getting through some of the language about automatic suspensions for things such as stealing, forging, or using a false permit on your car, resulting in a 5-day out-of-school suspension. We're also changing the language there. And as always, if graduation requirements change, there are testing requirements that will also be reflected. I would also add that our strategic plan is not finalized yet, so that always goes in the front of it. On completion. Hello, I have two new handbooks to add to the mix. The first is Rock Bend Area Learning Center, and they previously had an enrollment packet, and they followed the policies of St. Peter High School, but also had some policies from the MBED. They were in the MBED building. So we took all of those resources and put them together. So this is primarily based on the St. Peter High School handbook. There are a few things that I'll just point out that are new. We have a work-based learning attendance policy because our students, if they are engaged in a work-based learning seminar, do have a leave time for work. So that is something that's different. They also have an open lunch policy, partly because, again, that's when a lot of them are working. They're combining that lunchtime with their open periods to get a little bit more experience in the workplace. We also have a permission to drive to school, again, because that work policy and open lunch. And they have a requirement to have a continual learning plan on file to outline what credits they need to recover for graduation and what their individual plan is. So that is in our appendix. We also have a contract for enrollment, which is kind of a summary of a lot of the policies in place that we just go over with all of our students. And we have students in the So that is Rock Bend. And then we also have the Oshawa Learning Academy at the Hoffman Learning Center. Again, we had a staff handbook, and we had a Leo A. Hoffman Center handbook. So looking at those policies to really develop something that was specific to our learning community. So again, it's very much based on high school handbook. There are a few things, again, specific, like release time for therapeutic services. They need specific medical excuses from their on-site nurses, because again, they're in a residential facility. The medication policy is quite different, because all of their medications are issued to the center, not to the school at all. And then we have some very specific staff responsibilities for the supervision. All of those policies are a little bit different, but specific to the programming that we're offering.
Thank you.
Chairman Leonard, I move the exception of the handbooks for each of the levels for 2021-22.
I'll second.
Excellent, thank you. We have a motion and a second. Any further discussion?
Yeah, I just want to talk about the instructional program meeting that we had. It was just such a bummer. I mean, and I've found out from talking to other school board members, it's tough to find language teachers, and bigger districts are only getting like one that like offer German. They get one applicant, and that are much bigger, and we just had no applicants. And I think language learning is such a great skill and important. French is spoken on every continent on the planet, and so I'm just disappointed that we were unable to find a candidate. And we kind of get stuck being in St. Peter too, right? If there's a French job open here and there's a French job open in Minnetonka pays more, and they're in the metro area. That's why there's teacher shortages in we're very lucky for all the other subjects that we have. Smaller schools have a tough time finding science teachers. So anyways, I just wanted to let you know how the discussion went. Yeah, anything to add to that, Vicki?
No, I thought it was, how did the Spanish interview go? Did that? Yes.
Sweet.
No, it was really interesting, and then we kind of talked a little bit about the credits and things, so that's kind of coming down the pipes, but it was a very good meeting.
Excellent. Any other discussion? All those in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Approval of the Hoffman Learning Center lease for 21-22.
Yes, we have been leasing space. Actually, yeah. What time is it? Oh my gosh. With the changing program and them building new building, we are leasing space from the Hoffman Learning Center, and Tim is going to tell us a little bit more about that. It's come to the board from the Finance Committee. And I believe the Shared Programs Committee talked about that a while back as well.
Yeah, I'll be somewhat brief on this too. The Leo A. Hoffman Center built the building with the gymnasium and approximately 3 classrooms on the property. Close to one, right up there off of 99. So that's in addition to the current building that we've had where it's been housed. And we're leasing the 3 new classrooms and the gymnasium from the Hoffman Center. There's lease in front of you. It's been a moving target. As you can see, it started in 2020, so it's been a while as things have evolved with the program changes up there. The only things that still are still incorrect is the rent went up from $400 to $410 due to some equipment that is now going to be included. And then we're going to also adjust the dates from 2020 to 2021 when we change it. But it'll be 3 classrooms to start with. And I believe, and I'd like to thank Jana for really getting this over the end zone line here too. We'll still be probably using our building, some of the classrooms and things there too. And then the gymnasium is kind of replacing, we did bus the kids for FIED or the students to a different gymnasium in town, so we won't have that expense, that offset some of this here too. So, but otherwise it's basically a lease on the 3 classrooms and the gymnasium up at the Hoffman Center.
I just want to add that as we've had conversations about this, one of the concerns that we had was the number of kids that they were going to have. And right now the number is what, Jana? 25. Knowing that these classrooms are about 6 to 7 students per class, we are going to have probably 4 classrooms, if not 5, as more kids are brought into the program. So we will be using the 3 classrooms at the Oshawa Learning Academy. Hold on. That's how I remember it now. We'll be using those 3 classrooms first, and then we'll be doing overflow into our own building.
You have a question? So each classroom is $400 a month?
Yes, 410.
410,
Yeah.
sorry.
Yeah, so it'll be
Per classroom.
$1,630.
Good.
Is that reasonable? I have no idea.
Yeah, per square foot. It's a new building, new facility. And one thing with this program is the students are not residents or the majority are not obviously out of St. Peter, so we're able to charge back some of this cost.
That's right.
Participating schools. We still want to be fair, and that's
right. Nope.
I move that we approve the Hoffman Learning Center leases for 21-22.
I'll second.
A motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. What's that?
I
My voice got all spooky.
I thought you were yawning, actually.
Maybe
I don't
that
know
was
what
me.
I turned into a ghost. I don't know.
I was just doing a little check to make sure you're okay over there.
I'm just like gonna lean away.
Yeah. We will move on to the second/final reading of revisions to the policy manual.
All right, the policy committee has continued to be hard at work on policies. These came to you last month for our first reading, and there were no further changes to policy 601, which is school district curriculum and instructional goals. We're deleting our current policy 006.10, school district curriculum, instructional goals, and instructional materials. We are adding policy 604 for instructional curriculum, and then adding policy 618, assessment of student achievement, and there are no further changes. Our current policy kind of covered all of those, and the new policies kind of break them out into 3 separate categories. And I don't know if the policy committee had anything else to add to that.
No, I just want to thank you for helping us through that because it makes my brain hurt a lot. And you like make my brain hurt just a little bit less when you do it, so I appreciate that.
Well, thank you, and thank the entire committee for all the hard work on the policies. Really appreciate that.
I'll make a motion to approve policy 601, 604, 618, and the deletion of 6.10. Did I get that right?
Yep.
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. We move to our last action item of the evening, which is consideration of substitute rates for 21-22. We have discussed this in a couple of committees.
Yes, it was discussed in personnel and discussed in finance and ET.
So as you may recall, last year, in an effort to retain substitute teachers and paraprofessionals, we increased the rate of pay. We increased teachers from $130 per day to $175 per day, proration of that for half day. And our paraprofessional rates went from $11.60 to about $75 per hour. With anticipation that it would continue to be a challenge on substitutes, before the finance and personnel committee, and we're recommending continuation of those rates for the 2021-2022 school year. We do use ESSER funding to cover the cost of the increase. Any questions or thoughts?
I move that we consider the proposed substitute rates for 2021-22.
Second.
We have a motion and a second. Any further discussion? Hearing none. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Information items. Building and grounds report.
Yes, Mr. Bachman is going to join us to give us.
I was like, what are you doing? I thought somebody.
They're watching at home.
I'm smiling.
Yeah.
My eyes
That's
are
some
smiling.
sticking around.
We the custodial operations and maintenance staff is, for the most part, wrapped up summer work and cleaning throughout the district. Our goal was to be wrapped up by Friday the 13th. New teachers come in tomorrow at some school and following days at the other schools, and then all the teachers are back Monday. So staff will be prepared to bring in more desks or move desks out, whatever staff may be. So it's been a busy summer. We appreciate all their work. The buildings are feeling good. We only had a couple of projects this summer. We did significant tuck pointing on this building, on the west side of the building. That was completed completed in June. Next summer we'll be looking at
putting at South Elementary. The permanent restrooms and ticket box, ticket office at the high school is still in progress. The date for completion is Monday, the 23rd. It won't be completed completely on the 23rd, but they do have the area pretty much cleaned up. The students started showing up today for practices, and I think they have safe passage through the field. But it's looking nice, and I think weather has cooperated. We didn't have any rain delays. And then finally, because Read and Feed was suspended this year, we got some proposals to put new tile in the cafeteria at the middle school that is never not used. This was the 1 year it wasn't used, and they started ripping up the old tile today, and we'll have it done by Monday, they told me. Wow. Those are our significant projects. Nice. We're ready for the kids. Any questions?
No, thank you.
Thank you.
The speedy report. Second information item, first reading of a revision to the policy manual.
All right, once again, the policy committee had a pretty lengthy meeting last time. We were talking about a lot of policies. There were only 2 of them that we felt it was time to bring forward out of like however many we were looking at. So policy 605 is on alternative programs. We don't have a current policy regarding this. And so, and there weren't many changes. It's a very short policy. 608, instructional services or special education. It's also a very short policy. It's replacing our policy 6.7. The only changes we made to it is we made some language changes to make sure that the policy used student first language. So instead of saying something like disabled students, we're saying students with disabilities. And there are several points in that policy that we made changes like that.
Okay. It's probably just clerical, but there are still some that haven't been corrected.
Is there still in there? Okay.
One in B, and then I'm saying.
All right. Well, it's a first reading, so we'll dive into that again.
Good catch.
Yeah, eagle eye.
Nice.
Yeah, thank you. And everybody take a look at it and get your comments to policy committee or superintendent Sutherland. Or superintendent Sutherland.
It's all right.
Please don't wish
It's
that
all
on
right,
me.
Ben.
No. How dare you?
On many levels.
Yeah. Building principles.
All right.
One representative I'm going to give
Bless you.
I'm just glad.
But I had time to double the list of things I'm going to say.
Oh, bless you.
You know what, this week, I don't know if you had, or today, if you had a chance to drive by on either Grace or Broadway, you definitely noticed an increase in traffic because sports are back, started up today, so fall practices started. Mr. Rorcassi also launched his first parent and student meeting tonight, information night, so it has been a big day for St. Peter sports. I also want to let you know that K through 8, this conference sign-up opened up yesterday. So we were able to schedule conferences for parents that need assistance, or parents can pick a select a time that works best for them. And those conferences will be held on August 30th and 31st. And if anyone needs support in getting conferences lined up, make sure that they can just call any of the offices and we can help them with that process. Tomorrow, Jumpstart will begin for the middle school students, the 5th graders. This is just a great way to acclimate them into what a day in the life of the whole school looks like. It's a nice opportunity for them to have a chance to explore the building and learn a little bit more about what it's like to be here at the school. On Wednesday and Thursday, we will have 18 new faculty members that we will welcome at our new teacher workshop. And I have to just give a shout out to the building mentors who really do facilitate these 2 days and make our new staff feel welcome and answer their questions and get them set with some of the logistical pieces so that by the time they're on their site, that's their site and within their classrooms, they're ready then to just focus on instruction. And so the building mentors that will be leading this are Carly Bly, Stella Meixner, Chris Sandborg, and Chris Holmes. There's also been quite a bit of training that's been going on at MVET this week for special education care professionals and teachers. And next Monday will be the official kickoff of the 2021-22 school year. Our week-long workshop will begin on Monday with a kickoff gathering at Gustavus. There will be various mandated trainings that will take place just district-wide, as well as PLC and site-focused meetings that will happen over the course of the week. On the 26th, that's Thursday, right? South will be hosting an ELL parent night from 5:30 to 6:30. We will have Spanish interpreters available, so if anyone needs help completing any paperwork, we will have people there to help facilitate, answer any questions that they may have. We will also be doing a Somali parent night from 6:30 to 7:30 on the same evening. And it doesn't matter if the paperwork is yourself, whatever you have questions about, just bring them. We'll have interpreters that will help clarify what some of the processes may be for starting the school year. Just one reminder that this Wednesday will be the last of our food distributions that have been happening each week. And we really do need to thank Emily from Aviance and along with the kitchen staff, which has just done a fabulous job of providing so many meals each week for families. You know, it really has been a help to many, many families. And I speak for the entire group when I say it's feeling like we're ready to go. We are getting closer. The Sunday night jitters are starting, and you think your lists are long, but we just really need to say thank you to the custodial staff who has worked all summer to prepare our buildings, and any of our teachers who have done trainings over the summer so that we can be better equipped to serve our students. Any questions?
Thank you.
Thank you.
Thank you.
Superintendent?
Ron, Seth? Yes. Kind of like the Superintendent Soderlund idea. Just a little while. First of all, you know, I really want to thank the community members. There's still a few here. You know, getting that feedback over the last week and a half, 2 weeks, from everybody, just their thoughts, their ideas, their research. It's all important, and it's, you know, the schools belong to all of us, and we're talking about our community and our future together. So it's always really important to hear all of the different perspectives. I feel good about how many people showed up and voiced their concerns and voiced their ideas, and I'm not sure who said it, maybe John said it, just how diverse the perspectives were in the community. It really is split. And I think that was reflected in the vote at the end as well. And you know, hopefully the spread of COVID will decrease soon, and we'll be able to remove that layer of mitigation quickly, and that it stays that way. So, you know, I think you heard from everyone tonight that there's been a lot of work, a lot of effort going into preparing for this upcoming school year. We're excited to be having kids coming back full-time, in person, 5 days a week, and we really want to keep it that way. And so they're starting in just 2 weeks. 2 weeks from today will be the first day of school, and we're looking forward to that. And it was already mentioned that our new teachers are coming in this week, a little later this week, and we're looking forward to bringing them through orientation. And then all of our staff comes back for the big kickoff next Monday, and you all received invitations to the breakfast, and you're more than welcome to stay and listen to the speakers that we've arranged for all of our staff to hear at the high school PAC after the doings at Gustavus. Doings. My grandparents used to say that.
I've heard that before.
Yeah. Also want to remind families of the importance of filling out the forms for free and reduced lunch. Even though meals are free this year, it's really important to fill out those forms because there are so many other funding streams that the district gets that are based on those forms coming in. And those are dollars that are going to support our students through Title I, through interventions. Those are all supports that our students get. So please, please, please fill out those forms. They are available on our website now, so you can fill them out electronically. And as Doreen was saying, if people need language help, please direct them towards us. I believe there are Somali and Spanish forms on the website as well. So, website can help them out too. Yeah, with activities starting today, it was great to see kids out in the field practicing. You know, just like before this meeting, they were still out there. Hopefully, they're not still out there practicing. But completely looking forward to seeing everybody in the stands and cheering on the Saints. And we will be working on guidance for activities as well. And Minnesota High School League will be part of that. They made the guidance last year, and so we have to talk to our fellow districts in the conference and Minnesota State High School League, and we'll have that for you in the near future. But all the outdoor sports, we're good, because the masking is just indoors right now, so it's volleyball that we have to really think about right now. So that's it. That's enough.
Yep. Any questions? All right, around the table. Drew?
Just thank you, board members. Obviously, a contentious issue that many people in the community are worried about and concerned about and have strong opinions about. And it was tough for all of us to be responsible and studied and come to a position. It took a lot of our time, but I know that's the case. So good job. I think we've done what we were supposed to do, regardless of outcome. You did a nice job.
That's it. I support what we decide to do. That's what we do here on a board, and I'm kind of glad the vote actually was split like it was, because I feel like that kind of represents kind of where the community was. So, even though I was on the other end of the decision, but I will leave this meeting and be a pro-masker at school all the time.
Thank you.
Just an update for those not on the negotiations committee. We have a tentative agreement with the custodians and a tentative agreement with food service. So we are working our way through the other groups. That's all I got.
Echoing what Drew said, I think we're all just trying to do what we think is best, and I think we all have our heart in the right spot and trying to create the best learning environment we can for the students. And so I'm very proud to be on this board, and however we voted with what we thought was best, and I trust you guys. That was great. Whichever side you were on, I totally get it. So.
Superintendent?
Superintendent.
No. Oh, please don't wish that on me. So thank you to everybody on the board. On a personal note, tough decision for me on several levels, but I appreciate everybody on the board. I respect everybody's vote. I respected what I heard from the different members of the community that spoke. Anyway, here we are, and part of me, I think, you know what, I'm just gonna go home and let you guys deal with it, but no, we decided we're gonna be on the school board, so we gotta make a tough decision, and this is the way that played out, so be it.
Nope, I guess all I've got to say is good information. I really want to thank the parents. I mean, it was a great conversation and a good turnout that we had, so I really appreciate them coming in. But it was good information, and I think that we did what we needed to do. So.
Thank you. Yeah, I appreciate all of you, and that was a tough decision, and I don't, like you said, we'd rather not have to decide, but that's what we have to do. And we'll take away that everyone was respectful. When it was over, there wasn't a side whooping it up, and there wasn't another side screaming at other people, and we've certainly seen that on the news where there have been communities where that has happened, and I don't think people left here with that. I'm not going to leave here with that. Wanted to apologize for the motion. Yeah, I was just trying to further discussion. Wasn't trying to be out of order. I want to say that the 2021-22 goals, I did forward those. I wrote those up and forwarded those on, and then about 9 things happened last week. Some of them we discussed tonight, some of them we did not. So we will get back to that and come to that, and I will write a letter, which I will tell you at some point is still outstanding, so that we can continue that tradition.
Thank you.
And then committee and meeting plan for just how to do our business, as we talked about last time. We will continue to work on that.
Was that the document you sent out? Was that the goals last week, or whenever?
I sent it to.
Oh, sent it to you. Okay.
Yeah.
I got something else for you.
And then a few things happened.
Yeah.
Yep. It was as we discussed.
Right.
I did add COVID because we're still dealing with it, but we can decide whether or not to leave that or take that off. But I didn't make up 9 more.
No, I just wanted to see how you wordsmith stuff. And
yeah.
So.
In progress.
Okay. Cool.
Still working on it.
Sorry, it's way too late.
I'll second that.
Well, I can tell you what upcoming meetings are. Negotiations Committee, August 24th, which is a Tuesday at 4:45 p.m., and August 26th at 4:45 p.m. as well. Shared Programs Committee, August 31st at 4 p.m. In the middle school here in Conference Room AB behind me. Policy Review Committee, Wednesday, September 1st at 2 p.m. in the conference room behind me here at the middle school as well. Motion to go somewhere else.
I'll make a motion to adjourn.
Excellent, thank you.
Nobody wants a second. We want to just stay here.
Oh, come on.
Second.
I'll second. We have a motion and a second. All those in favor say aye.
Aye.
Motion carries. Meeting is adjourned. Thank you all very much.